Okay, if you can have everyone's attention, please. Hello, I'm Rhys Hart, so I'm the chair of the Youth Select Committee. Thank you very much for joining us today and providing us your evidence. Just to give an introduction to the committee, so far we've had 140 pieces of submitted evidence under an inquiry into mental health and young people's mental health, specifically around the areas of stigma, awareness, services and education. We're really looking forward to what you're going to provide us today to help us improve our report. If you'd like to introduce yourselves and just give us a brief cover of the organisations you're representing, please.
Okay, I'll go first. My name is Kenyon and I'm a counsellor by training, and I manage a youth counselling service called Heads Together, which is run by YMCA East Surrey. We work with young people between the ages of 14 and 25.
Hello everybody, thank you for asking us. My name's Margaret Maggie Clarke, and I'm the professional lead for school nursing for Leicestershire and Rutland. I'm also doing some work with CAMS in Leicestershire, but I'm here to represent SAPNA, which is the School and Public Health Nurses Association, and our remit really is to bring together really good professional practice for school nurses in the UK. So that's why I'm here.
That's great, thank you. In a few words, could you tell us what you think the current standards are of mental health services provided to young people at the moment?
Where to start? I mean, in terms of standards, I think I'm not sure I feel really comfortable to comment on that, but what I would say is the time it takes for a young person to see an appropriate supporter or professional if they are dealing with a mental health or emotional well-being issue is a really significant concern. Services just aren't responsive enough to young people when they first need help.
Yes, I think I would agree with you. I think they're inconsistent, and I think that's part of the problem. I think they can be very good, but they can be inconsistent, and I think people are not getting help earlier. We're not doing the early intervention that we know would be really helpful and really useful.
Thank you. Liam?
Thank you. My name is Liam Islam, welcome to the Youth Select Committee.
Thank you, Liam.
Earlier this week, we visited Children's and Adolescent Mental Health Service, CAMS Centre, and we had many views from the clinic, and indeed yourself from submitted evidence. I just wanted to ask Margaret in particular as well, because you submitted evidence, and then we can move on to Sarah and Dee. But can you describe how pressure on CAMS and other voluntary services has affected the service provided to young people?
I think it's increased waiting lists, and that's been very difficult. So young people who have been identified as needing some help or support haven't got it quickly enough, which means that it's exacerbating the problem or the issues that they might have. I also feel that there's been a reduction in the services that are out there, so there isn't as many places to refer people to. So where a school nurse might have identified somebody, we could have then sent a young person for help or support or advice, and those services are not always there. There is some really good work out there, but it is very inconsistent, and unfortunately it's very depleted.
I think what Margaret was saying was making me think about how unjoined up some of the services are. What we find often is that young people have been to see the GP, have been referred by the GP for CAMS, have waited quite a long time for an appointment with CAMS, finally go along for an initial meeting with CAMS, and CAMS say, you don't meet our threshold for support, and then they're back at square one. So then they'll come to us, and that's their first interaction with us as a voluntary sector service, and the whole process starts again, and that exacerbates the waiting times and does make young people and their parents, we often hear on the phone when we're taking a referral, but I've been waiting 3 months for an appointment with CAMS and now they won't see me, so you're telling me I've got another 3 months wait, so that's really tough.
I have to say that would be our experience as well.
Do you think that there's the greater impacts because of the decreased funding or the increased demand?
I think it's both, actually. I do feel that there is an increased demand. That's anecdotal and what I've read. But also the cuts have made a difference. We know that there's little money about, and it's the early intervention that I feel has been cut, and that's so crucial.
Thank you.
Yianni?
Hello, my name's Yianni. Evidence submitted by yourself at YMCA East Surrey is said that demand for the area's counselling services increased by 100% in the last 3 years. What would you both say would be the reason for this dramatic increase in demand?
I mean, I do think it just goes back to the question Liam was asking. I think there are two issues. There is generally an increase in demand for mental health services for young people, but the demand that we're facing as a voluntary sector organisation is also driven by statutory CAMS applying a sort of threshold limit ever higher. So maybe 5 years ago, somebody who has had one or two instances of self-harm, for example, might have been taken on by CAMS and offered some therapeutic support. Increasingly now, if that self-harm is not at a serious level, CAMS might say, you don't meet our threshold to work with you, so that then falls to an organisation like ours in the voluntary sector to provide that support.
I completely agree with that, and they often come back to school nursing, which is great, and we can support young people at a very early stage, and we're absolutely the right people at some point. But unfortunately, the thresholds are much higher now than they used to be, or they appear to be.
Thank you.
Thank you. Regan?
Hiya, welcome to Select Committee. My question is more focusing on about funding. So, as we all know, the youth, the young people's organisations to do with mental health have more restraints on the funding than the adult ones. So given the restraint on funding, where do you think pressure on mental health services needs to be relieved? And would it be possible if I start with Sarah, please?
Well, funding a service like ours, I would say that, wouldn't I? I mean, I think more involvement in the whole sort of commissioning landscape of voluntary and community sector organisations could be a way of making the limited pot of money go an awful lot further, because there's no question that working with voluntary sector organisations it does allow a more cost-effective way of delivering services. That's partly because we engage volunteers in what we do as appropriate, but also because we are smaller, we're a bit more quick on our feet, and it is. I think that would be one way of relieving some of the funding burden.
Thank you.
Obviously, I'm going to say school nursing as well, and I completely agree. I think we need some more joined-up thinking. I think we need to be working more closely with voluntary sector, with schools, with parents, with young people, and we need to be putting money into sort of much earlier intervention, into resilience, into helping people to cope at a sort of earlier stage, really. I think it's a bit more joined-up thinking and really asking people what would be the best way. But I'd like to see some more money into early intervention.
Yeah, thanks a lot.
Thank you. Rowan?
Hi, I'm Rowan. I'd like to move on to talk about improvements to CAMS, because both of you mentioned in your written evidence areas in the system that you feel are currently under-resourced. For example, Sarah, you mentioned about a narrow focus on IAPT and how that could negatively affect funding for counselling services. And Margaret, you mentioned about how services for the under-5s are under-resourced. Do you feel that treatment options currently provided by CAMS are too narrow?
Either or. Possibly, which is probably what you want to hear. I think we just need to broaden it out. And as I say, my focus very much is on early intervention and helping people to find strategies to help themselves, to support themselves. So yes, probably. I've completely lost my thread now, so I'm sorry about that. Help me out, Brennan. But yes, I mean, totally putting some money into the under-5s would be great, because the impact of parental mental health issues obviously has an effect on young people, and I'd like to see some help for parents to work with their children. Sorry, let's try a bit there.
Shall I just jump in?
Yes, jump in and then I'll come back.
When we talk about CAMS, I think sometimes we need to be clear what we're talking about, whether we're talking about the statutory CAMS service or the wider range of services for children and adolescents' mental health. So I think, when you said should some areas of CAMS be better funded, I think if we're looking at CAMS as the sort of wide remit, then yes, I agree that things like programmes for early intervention and prevention, programmes about raising awareness, helping young people take better care of their own mental health, be more aware of their emotional well-being. Things like that could certainly do with more more funding and more consistent funding, but that doesn't have to be done by statutory CAMS. It could be part of the wider sort of landscape of services.
I think it's about using schools as well, isn't it, and really thinking about working in a holistic way, building up those protective behaviours. So we're having this consistent message about emotional health and well-being, so from parents, from schools, from voluntary agencies, from school nurses. So we're really giving that whole message. But I think putting some money into maybe helping schools deal with young people and work with young people around emotional health and well-being would be sort of money well spent, really.
The Future in Mind report was talking about a need for more evidence-based treatment. So what evidence-based treatment is not currently provided that you'd like to see?
Golly, that's a very good question.
Should we start with Sarah, if you'd like to?
I'm not sure I'm going to answer the question quite the way that you envisaged, Rowan, but I think my point when I was responding on this was that there is a real focus on commissioning in health on evidence-based treatment, but as far as mental health has gone, the focus has been very much on the IAPT programme. So that's an adult programme, first of all, improving access to psychological therapies, and there's also now become a CYP IAPT programme. And I think it's really important that any funding that's given to within the health service, within education, it is evidence-based, but I think we've got quite a narrow focus on what we mean by evidence-based, and the emphasis on IAPT services is at the expense of services which work maybe in a different way but can still evidence the effectiveness of what they're doing. So, you know, for example, a service like ours, when young people come to us for counselling, we do ask them to complete what's called a core form, and it's just one possible measure of well-being, and we ask them to complete that through their journey in counselling. And what we were able to produce for our service is evidence that young people find the service effective, and that by going through a programme of counselling, that there has been a reduction in their level of distress. So we can produce that evidence, but that's not something that fits in a CYP IAPT programme. So I think the point I'm trying to make, not very effectively, is when we talk about evidence-based, we should be prepared to have a wide view on what we mean by evidence-based.
And not just the IAPT programme.
Yeah, I would totally agree with that. And I think there's a lot of work out there that does work for some young people. There's lots of different ways. There's counselling, there's coaching, there's all sorts of things. And I think we really need to look at that carefully and not be very focused on just one thing.
Also, you mentioned early interventions earlier and kind of the under fives. Are there any early interventions that you think could be provided or expanded currently? Are there any that you'd like to pinpoint? Or is it just that kind of idea of building resilience?
I think it's about building resilience. I think you're absolutely right. I think it's about building resilience. Helping parents to talk to their young people, to realise, you know, what's happening with young people, and to be able to do things with them. Really, I think that would be it.
I think an extra comment that I would make is we know that mental health issues can be sort of intergenerational. So a parent who's struggling with depression, anxiety themselves may well find that their child grows up to have depression or anxiety. Of course, it's not a sort of one-to-one relationship, but you know, parental mental health problems can be a good predictor of children and young people's mental health problems. So thinking about the support that's there for parents, particularly very new parents. So just to give you an example, something that we've been doing is working with a Sure Start centre where we've been offering counselling to parents of young children there who clearly have been struggling with their parental responsibilities because of their own mental health issues. So giving the parents the support might be a sort of long-term way of ensuring that those children themselves don't sort of emerge in adolescence with serious mental health issues.
I think that I would really support that, and it's about really working closely with health visiting, with the Sure Start centres, going into school nursing, into the schools, and really making sure we have a joined up approach to supporting parents with these issues.
Brilliant, thank you.
Thank you.
Terence?
Hi, I'm Terence.
Hello.
The SPHNA says that CAMS needs to work to your welcoming standards to make it more accessible to young people. So my question to you both is, how can CAMS be more welcoming for young people? Maybe if we start with Margaret and work our way on to Sarah.
I think we ought to be involving young people much more in the CAMS service. I think we ought to be asking them what they want and how they want to receive the services, what will be supportive to them, and not making it tokenistic, but making it really, we're accountable to young people and to service users for what services we're providing. And really making sure that we are using maybe social media or FaceTime, those sorts of things. And we're not just making services available when we feel they should be available, in the places where they should be available, really sticking to the You're Welcome standards, and that whole focus, really.
Yeah, I would say that sometimes some of the buildings where CAMS are offering services, and I'm talking about statutory CAMS here, can feel very sort of clinical and unwelcoming, and it can feel to a young person that they're being taken to the doctors or being taken to a sort of hospital environment, and that can be off-putting and can add to that sort of feeling of being stigmatised. So I think being able to offer services in really much more sort of a friendly environment to young people, where you sort of walk in and you feel like this is a place that I actually don't mind being, rather than I don't want to be in this waiting room which feels very cold and clinical. I think that's a real issue. I mean, I think there are some interesting initiatives out there. I know that in Streatham there is an organisation called Red Thread, who have worked with a local GP surgery to develop specifically a health and wellbeing practice for young people, and more sort of initiatives like that which really try and focus on what's going to work for young people and what's going to make them feel comfortable and welcome and sort of accepted. Would be good.
I think we sort of need to move away from we're going to a clinical place to see young people, and go more to seeing people in schools, say using Skype clinics, using places that people feel comfortable in. I think that's really important.
Thank you.
Thank you. Laura?
Good morning.
Hello.
A lot has been said in terms of early intervention and the part schools play in terms of children and young people's mental health. So how do you think CAMS could work better with voluntary organisations and schools in order to improve and facilitate early interventions?
I think programmes about preventative behaviours would be really good. I think it would be really good to promote good mental health, because often schools are really passionate about helping young people, but don't really know how to do that. So I think if they could work together to promote that sort of very early, those early programmes that can help teachers identify emotional health and wellbeing issues with young people, and they know what to do with them, to work with the school nurses who are there sort of every week. You can go in and see your school nurse, who are very highly trained. But I do think it needs to be something that they work with parents as well, because that seems to be a little bit of a gap, actually. I think a lot of schools are very passionate about working with young people and do various programmes, but don't always work with parents, so that's not always helpful. And I think the other thing is that they should really be consistent, because often you can go to a school in one area and get some really good protective behaviours work. You can go to the school down the road and it's not something that they do, and that seems unfair and unjust, really. So I think it's about having a real strategy about what would actually work in schools. But they've got it's a great opportunity, isn't it? It's a great opportunity for us to all work together, really.
On a slightly different sort of early intervention theme, I think the way that CAMS could work better with voluntary sector services like ours is to, I think I mentioned this in my submission, is to have what I call a common triaging approach, so single point of entry or single point of referral, so that there may be a range of services out there for young people, statutory CAMS, a community counselling service like ours, a specialist bereavement service, for example. If a young person, if a GP or a school nurse or a teacher can refer a young person to a single point of entry, there can be a single assessment, and that qualified assessor is able to direct the young person to the most appropriate service, and it's just there's a one-stop shop way of accessing a range of services. I think that would make for a much easier journey for young people.
Thank you.
Ryan?
Hello, I'm Ryan. This question is more directed toward Margaret. What mental health services should be provided in schools?
Oh, crumbs. Lots. I think I think it needs to start at the very beginning. I think we need to do some work with protective behaviours. So there's a real holistic view of emotional health and wellbeing for young people. I think there needs to be more school nurse provision. We know that where there is a school nurse going into school, it's very well used, very well evaluated. They're highly trained, and they can often stop things escalating, or they can help when things are sort of stepped down. They can offer really quick and very good support for young people in a sort of trusted manner, because there's no stigma in going to the GP or going to a clinical building. You just go and see the school nurse, and your school nurse might be seeing you about your pain in your toe or your emotional health and wellbeing. So there's no stigma there, which is brilliant and what we really want to do. And I really think that we need to be sort of joining those services together and really making sure that we have that firm foundation, I think. Is that what you meant, Ryan?
Yes.
Is it okay if I comment as well, Ryan? That, I think I was looking around the panel to see whether anyone was from Wales, and I spotted Sophie, because I know in Wales that school counselling is now mandated, isn't it? And I really do think that having a sort of a requirement to have school counselling in England and Scotland would make a huge difference, because there is inconsistency. And we see this as a voluntary sector organisation working with a number of different local schools. One school may have a school counsellor who's an individual who comes in maybe 1.5 days a week. Another school may have a school counselling service that they use, someone like Relate, someone like us, but there's inconsistency between schools. So I think if England and Scotland could move towards the Welsh approach, that would be one step. But I think it's also important to recognise that whilst I'm absolutely passionate about supporting school counselling, I also think there's a place for community services, because not everybody wants to access counselling in the school environment or access mental health support in the school environment. You know, we can talk about reducing the stigma around mental health, but lots of young people feel that they don't want their peers and they don't want their teachers to know what they're experiencing, and actually being able to take those issues outside the school environment where they feel that it's more confidential is just as important as having good quality school counselling and mental health support.
Yeah, no, I would agree with that.
Yes, please. Margaret, you mentioned about good experiences of school nurses.
Yes.
I wondered if you had any experience data to hand. Experience data to hand, any figures?
We don't have figures. There has just been a pilot in Leicestershire where I work about having a school nurse working in the team with some primary mental health experience, and the report's just been written, and it was very well evaluated both by parents and young people, because they got that evidence got that help really quickly, and they found that was excellent. So the report was great, and we're going to be building on that. I think the problem is that there is little evidence out there of really good practice, although there's some in Liverpool, I understand.
Do you know where we could obtain that report? Because obviously it would be useful when we're writing ours.
I can certainly send it to you.
Thank you.
Yeah, no, I would. I'm sure I'll get. I can send it to you. But no, it was very good, and it was highly thought of by both staff, young people, and parents. So no, happy to share it with you.
Thank you.
Yeah, you're welcome.
Hi, welcome to the Select Committee. We've spoken with quite a few young people and healthcare professionals about the concerns around the transition process between children's mental health services into adult mental health services. I think, Sarah, in your written evidence, you said even young people up to the age 22, 23, many of whom are just leaving education, can still find the transition quite overwhelming. So I was just wondering, in your opinions, how could the transition to adult mental health services be improved? If you want to start with Sarah.
I think it's a really significant issue, and the risk of sort of jumping the gun, I think it would probably be the thing that I would highlight as one key issue for this group to take away, that I think the provision for young people 18, 19, 20 can be really poor, because they may well have been in statutory CAMS or in a school environment or in a college environment, and then once they cross the boundary at 18, they're suddenly sort of an adult and they're under adult mental health services, and it's really not always appropriate and not what they want. I mean, we have historically been an organisation that's provided counselling service up to 25, and I'm really passionate that we carry on doing that. I think that's appropriate, but actually, getting funding for that is really hard. When we're talking to our local clinical commissioning group and saying we provide this service for 14 to 25-year-olds, they're very much, well, we can do this out of our under 18s budget, but for over 18s, if you're not an IAPT approved service, then we can't give you any funding, and that just seems really inappropriate. And we know that lots of young people are referred to us when they've been supported by CAMS, perhaps with quite serious mental health issues, and CAMS are basically having to sort of wind down the work with them because they're coming up to 18, I can't remember if it's 18 or 19, and they can't carry on working with them, and there isn't a clean transition into adult mental health services.
And I totally agree with that. That was going to be my one thing, but it won't be now. I'll think of something else. Totally. Young people are supported, and in a lot of cases very well. And then it feels that they sort of jump into this abyss, really, and that can't be right. Yes.
Thank you.
Francesca?
Good morning. We're going to move now to the education area. So a lot of the evidence submitted to us highlighted the need for improved education around mental health. Mm-hmm. So can you describe the level of mental health support and education currently available in schools, and to what extent do you think this is appropriate or is more needed? Start with Margaret.
I think it's inconsistent, and I think that's part of the problem, really. Some schools are excellent, and their staff will access lots of training and they will access lots of support. In other schools, they may not see it as such an issue, or they may see it as somebody else's issue. And I think hopefully from this, if something came out about some consistent approaches to education in school, that would be fantastic. And even things like using the use of language we use around emotional health and wellbeing issues would be wonderful, because there's a lot of strands to it, isn't there? There's sort of education around social media, there's education in schools, there's education, your sort of general stuff. So I really think a consistent approach would be fantastic.
So in this consistent approach, is there a specific procedure you'd like to go through in terms of the approach you think would be best?
I think it's the early intervention and the building resilience and building protective behaviours. I think that would be fantastic. Just to help young people to build some resilience would be wonderful. And you could start that off from the tiniest of ages and really build on it. And that would be fantastic.
Thank you.
Yeah, I think the inconsistency is a really important point, because schools operate as individual units, and what one school decides is a sort of a top priority, it may not be the school down the road's top priority. Some of it's driven by the experiences and the preferences of the heads or the leadership team within the school. So one school may be really good and proactive about talking about mental health and emotional well-being all the way through the sort of, right from going in at I'm thinking secondary school environment because that's what I'm more familiar with, right from going in at year 7 and having some work around transition for year 7s all the way through to supporting sixth formers, and having a really structured sort of programme that has specific issues that are hit off for each year group. That may be the picture in one school, but in another school it can be very sort of patchy and very reactive. One of the sort of sad things I would say is, and obviously it happens, but when a young person in a school environment takes their own life, it can lead to a whole sort of flurry of activity, and yet why does that need to happen afterwards? Why is the school suddenly panicking about having a programme about mental health and well-being after a young person has taken their life?
And I think some support for teachers would be really good around sort of crisis points for young people, because we know sometimes if there's a crisis point, it can be dealt with at an earlier stage, and it doesn't have to be escalated up. So I think some support and some teaching around that would be really good too.
Thank you.
You're welcome.
Thank you. Laura?
Do you think that teachers should have greater responsibility for dealing with mental health, or do you think it should be external experts that take the lead?
I think it's a shared responsibility, actually. I don't think it can be just left to one person. I think it's a real shared responsibility with the school, with voluntary sector, with school nurses, with parents, and with young people, actually.
So, do you think that teachers need more training on mental health?
Yes, I do.
And school nurses as well?
Yes, I do. I mean, there's some great practice out there, and we have got great pathways, and we've got lots of training. But yes, I do. I think they need, and in lots of areas, they're working very closely with CAMS, which is brilliant. There's some really good practice out there. I could send you that as well. And but yes, I think it's inconsistency, and I think that's the thing that worries me the most. Really.
I would be hesitant about placing too much responsibility on teachers. I think it's really important that teachers are educated about mental health issues and feel that they have a good understanding, but to expect teachers to take responsibility for the mental health and emotional well-being, a primary responsibility, is really unfair. There are so many demands on teachers, and I'm speaking as a wife of a teacher, so I do know that you know, so much is expected of teachers that sort of giving teachers this additional responsibility of being the person who has to take responsibility for the mental health and emotional well-being within the school as well. I really think it's important that we have some sort of professional external people involved, whether that's school nurses, whether it's voluntary sector, whether it's school counsellors.
I think that's why I'm thinking of it as being a shared responsibility, so it's sort of everybody's business, but we have people with expertise, and we know sort of where to signpost people to the most effective, the person who will sort of help the most. So.
Thank you.
Sophie?
Hi, I'm Sophie.
Hello,
other than formal PSHE classes, how else can schools promote awareness of mental health services that are available?
Well, there's lots of preventative behaviour and emotional resilience training around, and I think those sorts of things would be really good to really embed it into everyday life. So it's not something on its own, it's part of it, part of everyday life, part of the way we think about building resilience, building respect, building confidence in young people. So it's not a formal lesson where you're building confidence or it's about the way you approach your everyday life really as well. Does that help?
Yeah.
I think having sort of mental health and emotional well-being as part of the PSHE programme is really important, and I think that does happen. Whether it happens consistently well is a sort of quite a separate issue. We've sort of touched on that, but I think also if it just becomes part of the PSHE programme, that's probably not enough. So maybe there needs to be sort of particular sort of themed weeks or themed days around focusing on health and well-being. We've just been doing some work in a school where they invited a drama group in who put on a production called Hidden, which is helping young people sort of see how self-harm how it develops and how young people experience self-harm. And so they saw the production, and then they invited our organisation in to do some follow-up discussion groups with young people. That was year 10 that was aimed at. The idea was to sort of really check out what people took away from that production, what they understood about self-harm, how they could support peers who might be self-harming. So, special one-off events that sort of highlight specific issues can be really helpful as well.
We've got young people in Leicestershire, we've got a website, Health for Teens. But we're doing very much about positive mental health messages, and I think schools need to sort of go, so it's about how to cope with stress. Stress is normal, these things happen, but this is what you could do. You could eat things to make yourself feel better, do things to make yourself feel better. And I think those messages the whole time, the whole ethos, along with the sort of special thing would be really helpful.
Thank you.
Thank you.
Thanks. You've been talking about school nurses and how good they can be as a tool for young people's mental health.
Yeah.
I wondered, because of course we've got a far smaller number of school nurses than we have schools, how could access to school nurses be improved?
Well, we're working, school nurses are being are very innovative, and we are used to working with a very small amount of people. And we're increasing access through things like text messaging service, so you can have instant access to a school nurse. There's websites. I think we are using social media a lot more in a very safe way, because obviously when we set up the text messaging, people say, what if they say this, or what if they say that? So there are guidance out there to mitigate against circumstances like that. But it's about just being a bit more creative, actually. We're using virtual clinics with school nurses as well. So you see your school nurse in person on Monday, but on Friday you can make an appointment to have a virtual appointment. And young people have found that really helpful, because it just, sort of just reiterates and bolsters and helps. So we're being creative. I think that's it. And we've asked young people actually what they wanted. We went out and said, what would make it easier for you to access your school nurse? And they said text messaging and video clinics. We're also doing things like web chats, so we can do a web chat with your school nurse for an hour a week or something about certain topics, and they're setting the topics for us. So creative.
Sarah, are these the kind of inroads that you've used as a counsellor in schools?
No, I mean, I don't think we have got to the point where we're starting to sort of innovate around how we offer counselling in schools. I mean, counsellors in schools have always had to be quite sort of adaptable, because you're not always given a huge amount of time. Access to pupils for sort of a regular weekly appointment is almost unheard of. So counsellors do have to be sort of flexible in terms of how many times they can see a young person, what when they can meet, whether they're offering 30-minute sessions or 40-minute sessions, depends how it fits with the school timetable. But we, as an organisation, we haven't gone down that track yet of working, thinking about introducing sort of virtual consultations, but I can see that could be something that could be helpful and could allow more access to a counsellor or therapist than is currently available.
Thank you.
Should CAMS, the Children and Adolescent Mental Health Service, use feedback from young people, or should it allow young people to contribute to the development of the services? Should we start from Sarah?
Absolutely, yes. I mean, how can the service be running effectively if it's not seeking feedback and input from young people? And that's whether that's people who are actually accessing the services, who want to give their opinions on the treatment they're receiving or have received, or other young people who might at some point access the service or might have friends who've accessed the service. I think it's really important that, for anyone working with young people, whether it's statutory CAMS, whether it's school nurses, whether it's a service like ours, we need to be constantly sort of evolving what we're doing so that what we're delivering is appropriate for young people. And nobody changes as quickly in society as young people. The way, the whole sort of adolescent experience for my teenagers is so different from my own adolescent experience, and it probably will be again in another 10 years' time. So we have to be really thinking about how our service keeps changing to keep pace with how teenagers are living their lives.
Totally agree. I think we need feedback from young people, but I think young people need to be involved in it. I think they need, we need to be accountable to young people for what we're doing, and not just make it tokenistic. We'll ask you what you think, and then we'll do it. Okay, but it's absolutely having young people at the heart of what we do and what we're planning and where we're going. So.
One thing I'd like to add about that is it is actually quite hard, though, when you're working in the area of mental health, to have really active engagement of young people, because it comes back to something we talked about earlier, which is around the stigma around mental health. So a lot of young people who might have experienced mental health difficulties themselves, or have friends who've experienced mental health difficulties, may feel quite reluctant to speak openly and publicly about that. Now, we really like to see that changing. One of the things that we're doing is working with a programme to develop what we call young mental health champions, a group of young people who have either got direct experience themselves or, just interested in the area, who are willing to sort of invest a little bit of time and effort in building some skills and expertise themselves, and then be sort of peer supporters, peer champions, either in a school or a college environment. So I think for that to happen, we need to make progress in that whole area of reducing the stigma of mental health, reducing the embarrassment of talking about it.
Yeah, there's some, obviously you've probably seen the work in Liverpool where they're changing the name of CAMS, and I think those sorts of initiatives would be really good, because maybe that's what it needs to really change that stigma around it. So,
thank you.
We spoke about CYP IAPT, which just to clarify is children and young people's improvement to access to psychological therapies. Now, this program's been running since 2011. Would you say it's been successful in allowing young people to access psychological therapies, or?
I think it would be difficult to be prescriptive about that. I think it's probably variable, would be my experience. I think it's probably great.
I honestly don't know, Reese, whether it's deemed successful or not, but my concern about the programme is that it very much institutionalises the therapeutic support for young people as being something that comes from the health service. You know, for someone to train as a CYP IAPT practitioner, more or less they have to be somebody who's within the existing NHS structure at the moment. So I'm a counsellor, I work for a voluntary sector organisation, I work with young people, but for me to bridge that gap, to train as an approved CYP IAPT therapist, is virtually impossible. It's not a sort of open programme for anybody who's working in a sort of therapeutic environment for young people. It's very much an NHS driven programme, and I think that's a shame, because there are a lot of very good and effective school and youth counsellors out there who are providing good quality support which they can evidence as being successful, but it doesn't fit the CYP IAPT mould, and that's my concern about that.
Okay. It goes back to our earlier answers, doesn't it, about the range of evidence-based approaches, I think.
Yeah. Also, you've both talked about kind of sometimes it's hard to find data and such as, or to see how programmes have developed or been successful or not. Baroness Tyler, in the debate last week in the House of Lords, said, would the Department of Health and NHS England therefore commit to publishing an annual progress report on the implementation of Future in Mind? Is this something you'd find useful for your organisations?
Great. Yeah.
It would be something of use to you.
Yeah, but I think it's important that a progress report and data has a sort of variety of strands to it. So, you know, I think it's really important that when you're seeing young people that there is some sort of quantitative measurement of progress, and that's why I think, you know, ticking boxes on a form unfortunately is part of the therapeutic process. But I think qualitative evidence, what young people say about their experience, how they describe their experience, how they describe, you know, the changes that have been brought about from them, is just as important. And I think if we think about evidence as just being data and not being what people say about it, then I think we're missing out on, you know, some really rich feedback.
Yes, I totally agree with that. I think we need a range of evidence bases to make sure that we're really delivering the right services. But yeah.
That's great. Are there any other questions?
Hello again. The mental health service budget allocates 6% to CAMS. However, 25% of mental health issues are around young people. Would you say this allocation is fair? And if no, what would be a more fair division?
It's not fair.
Totally unfair.
But it's
totally
very,
unfair.
We have to be realistic about the environment that we're in, particularly the sort of the cuts that we're experiencing. We have views that we don't agree with them, but we have to sort of structure services within the reality of them. I think the whole issue about parity of esteem of mental health, about the lack of funding for both adult and young people's mental health services, is a very real issue and something that has to be taken seriously. So, you know, I would argue strongly that there should be increased funding for mental health and well-being, emotional well-being services, particularly for young people, because we know that most adults who are experiencing significant mental health issues, which may be stopping them working, maybe getting in the way of them being effective parents, those issues invariably started in in youth and adolescence, and if we don't deal with those issues, then we're storing up long-term, lifelong problems for adults.
And if you're talking about cost effectiveness, we know that early intervention is hugely cost effective, not just emotionally and financially. So completely agree.
I mean, the Future in Mind paper makes a really strong case for investing significantly in services for children and young people. So I don't think we need to sort of make that case. It's very strongly made. The financial case, I mean, that's just the financial case, notwithstanding the sort of the whole sort of social and emotional case for better investment.
Is there any way communications could be improved between organisations and services to help care for young people, especially in transition periods? Does that make sense? So transitioning from school to another school, for example, if a child has mental health.
I think we need clear pathways, and I think we've started to do that, particularly in school nursing. But we need clear, joined-up pathways and clear expectations. I think that would be one of my recommendations.
I think there's always a tension when you're working, confidentially with a young person, between sort of maintaining that confidence and letting the counselling be private, and recognising that the more other agencies who work with a young person know, the better. So if we're working with a young person who's also got a youth support worker because they for whatever reason, it would be good if we could agree to have a sort of constructive dialogue without breaching the confidence of what the young person's talking about to the counsellor. I think
that's where the sort of pathways would come in. You could be very clear about what each organisation was expected. I think what you need to cut down is like telling your story lots and lots of times, and I think that must be, that's something we could really do with working on actually, and something I'm hoping to work on with young people.
That's great, thank you. Peggy?
Hi again. Last week in our private evidence session with young people, they continually told us that they are losing faith in the services and using the services, especially because of the budget cuts, etc., etc. So what role can the schools and also school nurses do to bridge those barriers and actually ensure continuity with the faith of young people actually using the services, if that makes any sense?
I think we do need to actually ask young people. We say, what is it? What is it? Where is it actually going wrong, and where would you like to see it going right? And we know we have no magic wand, but there are things we can do to make it better and make it more effective. And it can be small things, can't it? Like not meeting in the right place or not meeting at the right time, or but we don't know that, and it would be wrong to speculate. So I think we have to really, and sort of go back to my previous point, really include young people, don't make it tokenistic, and really act on what would make it effective for them.
Thank you.
Thank you.
I think we would have a lot more confidence from young people if we seriously address the waiting times problem. I think people lose faith if they're kept on a waiting list for 3 or 4 months at a time. And I'm be very open. Our service has to do that because we haven't got the resources to see young people any more quickly. But I think sometimes as adults you forget that 12 weeks is a heck of a long time for a 14-year-old. Time moves in a different way. I think 12 weeks is quite a long time to wait, but I think if you're 14 and you're dealing with really significant anxiety issues, that 12 weeks could be the difference between nipping those issues in the bud and helping that young person cope for the rest of their life, being idealistic about it, and those issues getting completely out of hand.
That's why I think we need to use a range of strategies, like using social media, like using text messaging, just as we can get those waiting lists down a little bit as well, and in a way that young people would be able to use.
Thank you.
Thank you. Saskia?
We visited a CAMS centre yesterday, and there we were told about a UNICEF report, I think from 2007, so slightly outdated now. However, they said that the results that are coming in are still quite relevant today, in which UK children and young people were actually deemed the unhappiest out of all the industrialised countries. This could explain our increase in demand of services, but why do you think that children and young people in the UK are so unhappy?
I think there's a lot of pressure on young people. I think there's a lot of pressure through social media, through parental expectations. We know that there's cuts in jobs. That gives a lot of pressure at home, which consistently young people respond to. I'm not sure there's one answer actually, but I do think there's a range of pressures. But it's sad to hear, isn't it, that it's like that for us.
I think it's very much a sort of reflection on sort of the wider social and economic environment that young people are growing up in at the moment. So I do think the sort of massive change in social media has had an impact, because I think young people, they have no downtime. They're on it 24 hours a day. The number of young people we see who have experienced a bullying issue at school, which doesn't stop. They come home, it's still ongoing, there's messages, they're on Twitter, Instagram, whatever they're on, it's carrying on, they can't get sleep at night, they're still getting messages coming through. I think that really exacerbates problems and has added to sort of unhappiness, and we need to be aware of that. But I think, for a young person going through school at the moment, the pressure to get good results, the pressure to go on and get their A-levels and go to university or get an apprenticeship, knowing that there aren't that many jobs out there, that there are a lot of low-paid jobs, zero-hour contract jobs, it's quite a tough environment to be growing up in. And I think we have to be mindful of how much the wider social context impacts on individuals' mental health.
So I think we need to be providing some, real support for young people. And social media is there, isn't it? And we have to, appreciate it's going to always be there. But I think it's about having good places for people to go to for good information, so you can have some downtime or talk to you about what's worrying you. But yeah, it's sad.
Thank you.
Thank you. The final question: if you could have or see any recommendation in a report, what one recommendation would you like to see?
They've taken my transition.
If you'd like to go first, Sarah?
Do you want me to go first?
You
because we were asked to think about that, and I do think I did it between, shall I focus on the role of the voluntary sector, but actually the whole issue about transition at 18 I think is really significant. I think having services that recognise that young people don't transform into adults at one fixed point, and that there's a huge sort of amount of development still going on when we're 19, 20, 21, brain development in particular, and having services that are appropriate for young people, and by that I mean young people up to their mid-20s.
Thank you.
And you're not going to be surprised to say I'm going to say more school nurses. I think they can, school nurses, if we could have more school nurses, one at each school, that would be fantastic. There's non-stigmatising, we're very used to working with young people, we're used to listening to young people, we're used to developing services with young people, and we have that bridge between health, social care, parents, so I think more school nurses.
That's great. Thank you ever so much for your time. And with that, I close the first panel of the day. Thank you.
All right. Thank you. Thank you so much. You've all been absolutely lovely. Thank you.
Yeah.
What should we say?
You know, I find Clarke so cuddable. I just want to be like, oh no, this is adorable. I don't know, because I think there's a nice sense of the power with, workers. Because they don't look, you know what I mean? Some of them look like those sorts of them. The civil service, especially. Some of them, they're quite
really nice thing to say. I think probably people here would disagree with you. They would say Clarke's very, like, a lot of people feel Clarke's very, like, aloof and they're very elitist and they don't talk to people. But that's because they can't.
Because obviously it's right.
Yeah, and I think it used to be, they used to be quite snobby, but things have changed a bit in the last kind of couple of decades, so we're much nicer people now.
Yeah.
But, like,
Also, yeah, because she yeah, I asked her, well,
Which is good. It wasn't in a select code too long. So it's just then I had to
oh, is there a contract? Oh, don't forget.
I think so, but I'm supposed to ask Anna.
I was basically just I couldn't quite remember what you're doing tomorrow, so I told them you were going to be going into the select committee. I was like, I say usually like proper MPs. Not quite.
Sorry?
Some of them are like Some of them are like all appointed.
No, they're all selected, aren't they?
Yeah. It's the youth forum. It's got 3.
Yeah, everyone else is just appointed. You know, democracy. Love it.
Said if you want the residential, they're going to apply. Yeah,
Number 7.
Hello everyone, can I have your attention please? I'll now begin panel 2 of the day. First of all, welcome. I'm Regan. I'm the chair of the Youth Select Committee. Thank you for joining us. We do really value your time to come down here and speak to us. If you'd like to introduce yourselves and just say a few words about the organisation you're representing, that'd be really useful. Thank you. If you'd like to start, Monica.
I'm Monica, and I'm a member of Youth Parliament and also a member of Hearts 1125, which is sort of made up of the Youth Parliament people and youth counsellors and things like that from our constituency, Hertfordshire.
Thank you.
Hi, I'm Ahmed. I'm also a member of Hearts 1125. Just go into a bit more detail. It's just a group of young people from across Hertfordshire who come together. It's run by Youth Parliament, and we collate 5 issues which are quite relevant to young people, and we form a manifesto which we present to our local authority to try change those issues.
Thank you.
Hi, I'm Thomas Yems. I'm a member of the NHS England Youth Forum, which is a group of young people from right across the country that represents the views of young people within the NHS.
I'm David McIntyre. I'm also part of the NHS England Youth Forum. To go in a little bit more detail, we were set up last year. There was 20 young people on that, and we worked on 3 key areas, one being mental health, one on transitioning, and another on signposting and communication with healthcare professionals. And I know this year, with a new elected bunch of 25 young people, I know that they're working on children in care and also the transitioning services in a little bit more detail.
Thank you. Just to begin with, in just a few words, could you talk about current mental health services and what kind of standards you think they're at, or such as? If you'd like to begin, David?
Yep. Sure. I think it's a bit patchy, really. You know, here and there's some really good kind of best practices in other areas that are not so good. And I think, like it's already been said this morning, there's a little bit of kind of inconsistency with kind of the standard of mental health or what some kind of areas within the NHS or some services see as kind of mental health services, whereas others maybe not. So I think kind of the standard is it's good in some cases, but in kind of the majority of the cases we're kind of falling short, purely because there's no real standard that everyone can set themselves against. So yeah.
Thank you.
Yeah, I agree with most of what David said, that it's a very mixed picture across the country. We get reports of young people having good mental health services, and then reports clearly of young people of not quite having the service that they expected.
Thank you.
I think what we found was the quality of the service was quite high. However, the waiting was the main problem. For example, with CAMS, we found people had a good few months to wait before they kind of entered the system, so that kind of made their kind of situation deteriorate. So I think that's probably the key aspect which need to be addressed.
Thank you.
I would agree with what Ahmed said about the waiting. I think the quality of the service is pretty good, but I think like the waiting, people kind of have like more of a negative view towards it. But Hertfordshire specifically, I think there is light at the end of the tunnel, as there is a lot of talk going on currently, and we're in the really early stages of making changes within our local CAMS.
Thank you. Brian, if you'd like to begin.
Hello, I'm Ryan. First question is for NHS Youth Forum. Can you briefly just outline what it is the NHS England Youth Forum does and who is involved?
Yeah. I started speaking, so. Well, like I said, it kind of was set up last year, back in January, as part of the NHS Citizen Programme. And kind of the main premise of it is to engage with young people in kind of learning from their experiences of their kind of NHS health service and looking at ways of improving it better for young people. There's 25 young people on now, which are elected, or some are selected through the process. And they come from a variety of different backgrounds across the country, and they work with a variety of different healthcare professionals, all levels in the Department of Health, NHS England, and Public Health England. And like I say, they kind of pick key areas that they feel they should be prioritised and kind of work with those healthcare professionals and kind of bettering and improving the areas for young people.
Yeah, I'd agree. I'd probably just add that one of our aims is to share best practice. So we're not out to reinvent the wheel, but we aim to share best practice between some of the excellent work that goes on within the NHS in England.
Okay, and then since your year from being founded, what have you done in relation to mental health?
So we had a mental health awareness event last year, around this time, and that came out with some interesting stories from young people and some interesting recommendations from it, which included things like things around destigmatisation and other bits and pieces.
Yeah, just to add on that event, because I know you weren't there, were you? So I should have said something. It was more kind of, we took the approach of not necessarily focusing on the negativity of mental health, but kind of the whole premise of the event was celebrating young people's positive mental health. Because I think it was, we all decided as a group that, mental health isn't just kind of the negative side. You can have a positive mental health, and everyone should have a positive mental health to kind of, be healthy. And that was kind of bringing together a lot of healthcare professionals, but also other external organisations that we viewed as having best practice. And the event kind of served as a sharing of that best practice. And it was fundamentally kind of youth-led, which kind of allowed the healthcare professionals that came to the event to talk a little bit more freely and frankly, less clinically, and it was more of an informal setting, so it wasn't too kind of business-like. It was much more of a kind of relaxed atmosphere that people could come together and actually talk quite freely about their experiences, whether they were good or bad. And that was kind of the idea of, if you do have a bad experience, it's okay to talk about it, because the whole idea of the youth forum and also why these healthcare professionals are coming here is because they care about kind of making the health service better for young people. And I was going to say something else. Oh, yeah, and about the legacy from that event actually is a lot of young people kind of came, and within a few minutes everyone was talking about mental health as if it was a good thing. There wasn't any of this kind of, it's a bit of a taboo, no one really wants to talk about it. Everyone was actually engaging in a discussion, and actually quite a lengthy and proactive discussion that actually mental health is something that we should all kind of, be a part of for each other, but also for ourselves.
Thank you.
As we said, we have received over 140 pieces of written evidence, and we had a session last week where providing more information. But just based on your experience, I'd like to direct this one to Thomas and Ahmed. And based on your experience and the research you've done, could you describe the levels of awareness of mental health among young people?
Okay. Young people kind of know about mental health, so in our findings we found that 42% of people had kind of a basic understanding of mental health and how to deal with it. However, on our surveys we asked people about kind of local counsellors to talk to in their schools, and we had different responses. Some people said they didn't know if they had one, some people said they didn't, some people said they did, kind of showing that there isn't that knowledge of where to go. So I think that's kind of the problem. There's not enough awareness of it or who to go to, but I think people do have a basic level of understanding.
I think people think they know about mental health. There's a reasonable amount in the media about mental health and the problems with it, and trying to solve mental health issues amongst young people. I'm not totally sure that young people really understand what it's about, or that people in the population really understand what it means to have a mental health condition. I also think that young people don't really know what services are out there for them. Services exist that they don't know exist. And I think that's one of the key issues around young people's mental health services, that if you don't know where to find them, you're not going to use them.
Thank you.
Thank you. Liam?
We've received lots of written evidence. By the way, my name's Liam Islam, nice to meet you all. Welcome to the Youth Select Committee. So we've received lots of written evidence over the past few months, and one young person said that I do not know of a specific organisation in my area which is easily accessible and well advertised, which young people can go for advice / support with mental health. So why do you think so many young people are unaware of mental health issues or about services that are available to them? Shall we start with you, Thomas?
Yeah, I mean, I think the answer is actually just simply education. The fact that schools could be better engaged in what mental health services exist, as well as sort of an education level. I also think that going to young people where they go, in the sense of scout groups, cadet groups, youth centres, and all these other places that young people receive information from. Take soaps. If you've got a reasonable mental health storyline in a soap, that is actually probably more effective at education, perhaps, than actually sitting someone down in a classroom. And so there's this whole jigsaw approach that we can take to advertising mental health services, and that I think needs to be better done.
I think it kind of links in quite well with what we did as a youth forum last year with the whole signposting communication. I think it is very much, well, what we found is that sometimes young people don't know about the services because the healthcare professionals don't necessarily know about all the kind of services that are available in the provisions. And so I think it's kind of having a clear map of, if you're in a particular place, where you can go, what the different routes in the healthcare system that you can take. Which is something that we talked heavily about last year as a youth forum with healthcare professionals. But I think that's kind of maybe, as well as education, it's the kind of actually signposting and telling people that if you want a particular service, this is kind of where you go to get it, rather than, because I think sometimes some healthcare professionals have said that they were kind of had the mantra that, you know, we won't go to people, people will come to us. And I think it's kind of got to have that compromise, meeting in the middle way of actually saying, you know, you've got to come to us if you require the service, but this is where you actually come to get the service. I think that's what it's kind of like.
Thank you. Rowan?
Hi, I'm Rowan. NHS Youth Forum, you mentioned in your evidence about the transition from CAMS to AMS, yes, and the use of a personalised life course approach, focusing on individual cases rather than tick box exercises and age. What do you feel are the main problems with that young people face during this transition?
So it's the transition process is actually slightly more than the different place that you go to and the different place that people that you see. It usually is accompanied by a wholesale change in how your healthcare is administered. And so as an adult, you're given more responsibility for organising your own healthcare, as opposed to as a young person where it's more organised for you and you're given much more help and advice in sort of supporting your healthcare. And so it doesn't help in my mind that this transition process occurs at roughly the same time as moving on to university and other massive changes in your life. It just adds an extra stress to it. So it would be useful if you could move that to suit that individual young person. So that might actually be before they go to university, or it might be after they go to university, or after they've got a stable job, or however it feels to that young person. There's also a small issue with mental health services in particular, that the remit of CAMS is larger than the remit of AMS. So there are young people who can't be discharged from CAMS, but yet don't meet the criteria to go into adult mental health services, which essentially means they get discharged from CAMS at 18, which is a bit weird to anyone from the outside. It just seems like, yeah, so you've got a condition that I can't discharge you for, but I can't treat you past this point. Seems a bit odd to me.
Monica, would you like to chip into this?
I think, especially from what we heard from some of the evidence earlier about how when you hit 18, you're not automatically an adult. You don't wake up on your birthday and think, oh, I'm an adult now. So I think just kind of repeating what other people have said, it's very personal to you. Like, everyone develops and stuff at their own speed. So I think if you want to stick with your counsellor you're seeing, or if you don't feel ready to move on, then I think like all services should really try their best to accommodate for that.
What changes, kind of open to everybody, what changes would you like to see to improve transition?
Kind of just throwing in some best practice. But I think kind of following on from the example of Southampton hospitals with their Ready, Steady, Go kind of system, kind of the red, amber and green process that they go through, that's very much an individual kind of case-by-case transition. So, moving at the speed of that young person. And also, the kind of, I think, the very special thing about that is it's not just about their health and the care that they receive, but it's also looking, especially if they've got a long-term mental health issue, looking at kind of career progression and where they can actually go kind of beyond as they go into the world and actually, lead a life and lead a normal life as much as they can. So I think in some kind of making it better is that kind of thing. But also as well, on another kind of note, is when we've spoken to young people, it's kind of, again, it's the inconsistency of mental health provision that, some CAMS services finish when you're 16, some when you're 18, some, in very rare cases, extend their CAMS kind of provision to 23, 25, which kind of works and kind of doesn't, especially like was said in the previous panel, the fact of when it comes to funding, the funding stops at 18 and you haven't got enough funding for obviously carrying on 25. So I think to kind of make it better again is if you had that kind of conformity, across the board of when, you transition from CAMS to AMS. I think that's what's really key as well, because then you can kind of set some kind of national kind of best practice that can be rolled out everywhere, instead of, you can't necessarily do that now because different services in different places run differently.
On that Southampton point, could you go into more detail about what that Ready, Steady, Go programme entails?
Yeah, it's relatively easy process in the extent that it's very much, there's a particular checklist that a young person will go to, and it doesn't just involve the young person and maybe their healthcare professionals, but also their friends and their family, because especially when it comes to mental health, the care that a young person would have is not just a healthcare professional, everyone is involved, and it's more of like a team effort. And in some cases, the young person would visit the ward that they might necessarily be moving on to, and next time they're admitted or something like that, they'd meet with service providers that treat the AMS rather than the CAMS, so they get to know and try and build some of those relationships before they necessarily need to use those services, but the relationship's already there, which I think is really, really crucial, because especially with mental health, a lot of young people it's one of those, you kind of, especially if you've been with a mental health for some years, you've kind of got used to the people, they've become very much part of your life. Taking that away and expecting you to, have that same relationship with someone completely new is actually quite hard, and I think it works in Southampton. So,
brilliant. Thank you.
Regan?
Hello, welcome to the Select Committee. Well, this question is more focused on about education, so education and mental health. So in the call of evidence, especially in NHS Youth Forum, you've said that there's no education on mental health and it's not sufficient. And if I pronounce it right, Hertz? Sorry, is it Hertz 1125?
Parts 1125.
Yeah, sorry, I couldn't pronounce it. You said that you would like PSHE lessons to cover a wide range of issues for mental health problems, such as self-image, eating disorders, and also external training workers to work with them. But my question is to Ahmed and to David, do you think that mental health education should be made compulsory? And if any, are there any drawbacks if they are made compulsory? So can I start with you, Ahmed?
I personally think it should be made compulsory. It's like any other injury, it should be kind of treated. We don't want like young people to become specialists in the topic. We just want them to have like a basic knowledge, basic understanding of the signposts of it. Because with eating disorders and self-harm, it is extremely damaging to the person. So trying to find it early is the best way to kind of help that person recover. I think though training should also be given to staff. In our survey we found about 90% of teachers and people who work in schools wanted a mandatory mental health education for them as well, and how to kind of treat people with it. So I think there needs to be education for the teachers teaching it, and also for the students to kind of look at the signs before it really turns quite bad.
Thank you. David?
I pretty much agree with everything about that. I'd say kind of as a drawback though is probably one of the main arguments against making it compulsory in teaching is kind of where it would fit in the kind of national curriculum. I know that I think it was 2 years ago that there was a Youth Select Committee on the Curriculum for Life, and I know mental health was again a key thing there. And I think that as well, last year a BYC focus group on mental health showed that 67% of the people that were questioned said that they felt their teachers were kind of reluctant to approach the kind of subject of mental health because it's such a taboo. It's one of those things that, if we don't notice it, then it doesn't happen, which I think is not necessarily, a bad thing on the teacher's part. It's just that kind of way of us thinking is we don't particularly want to talk about it. But I think that it should be compulsory in education because the whole point of education is, obviously academic is part of education, but also kind of the well-being of a person and educating yourself in the well-being of yourself and also your friends. So I definitely think it should be compulsory.
Can I just add something onto that? I think we live in a kind of coping culture as young people. If we feel kind of depressed or something, we keep it to ourselves until it really gets too bad. I think by adding kind of PSHE compulsory and making it compulsory, it kind of levels that down so people can be more open about how they feel and it's not just kind of a teen going on a strop.
Thank you.
Can I just add another bit as well? Sorry. Sorry. I realise I've talked a lot. The other thing about mental health as well, I think that kind of the early intervention is the fact of kind of promoting a positive mental health from a very young age. It's not all the kind of the self-harming or illnesses, but there is something good about a mental health, and I think that is some way of kind of tackling the negative side of mental health. Is that if people are made more aware and we promote and push for everyone should have a positive mental health. We should talk about things. There are certain things that as we go through in life we are submitted to stress and all that kind of thing, and that's completely normal. So I think that's something else.
Thank you.
Thank you. Terence?
Hi everyone, I'm Terence. My question to you today is, at what age should teaching on mental health be introduced? And maybe if you start off with Monica and move on to Thomas. Thank you.
Well, with us, with Hearts 1125, we are 11 to 25, so that's where all our data comes from in our manifesto. And considering some of the people we surveyed were 11 years old, I think the results were quite shocking. I think you can start teaching people very subtly about things at a very young age. Like even if you started juniors, that's like year 3, not necessarily talking about like going into graphic detail about like self-harm and eating disorders, but maybe like teaching about healthy eating and positive body image and things like that. And also just like being nice to each other and things like that. I think the earlier you start kind of not pushing these people in the right direction, but kind of guiding them, the better and more likely they are to be more positive later in life. So I think the earlier you start, the better the results will be kind of later down the line.
Thank you.
Yeah, I would say from the start of primary school, so age 5, and the reason for that is twofold. One is that mental health needs to be something that we just talk about, and just as we talk about the football, it needs to be something that we can have conversations with each other about. And I also think that, yes, right, at age 5 you probably don't want to be talking to people about self-harm and depression and things, but you can certainly talk about having a positive mental health and being friendly to each other. And I think it would add on the emphasis of not just talking about negative mental health, and that people can have positive mental health.
Yeah, thank you.
Thank you. Liam?
We've received lots of evidence regarding this. Hertz 1125?
Yeah, Hertz 1125.
You described a peer mental health champions programme led by Youth Connections Hertfordshire. That was in your written evidence, I'm assuming. So we've received some evidence about this from other people as well, but how do you think, how effective do you think peer support programmes are, and what are the benefits and drawbacks of this?
I think it'll probably be quite positive. I think by having that peer mental health champion, it's someone they can relate to, it's someone they can go to, they feel comfortable with, unlike a teacher or maybe a member of family. It might make them feel quite uncomfortable, but having that person they can kind of fully trust would be quite good. I think the drawbacks would probably be, I don't think it'd be promoted enough in like schools and local areas. I don't think people would know who to go to as well, because they might seek advice from like CAMS or go somewhere else.
for other services.
Monica?
I would agree with what Ahmed said. Touching on the drawbacks a little bit more, I think if you felt uncomfortable with your peer, then you might be like not really sure who to talk to about that. But I think it would be very useful, especially if someone's the same age as you. You can relate to them a lot more and be more open with them. Also, it's sometimes kind of awkward talking to your teachers because you feel like what you say out of the classroom may then be taken into the classroom, and the last thing you want is sort of like special treatment, if you know what I mean. So I think having that person who you can just talk to is a really good idea.
Thank you.
That's great, thank you. Yianni?
Oh, my name's Ewan. The PSHE Association have said in written evidence that without the sufficient training for mental health, sometimes the education can be counterproductive and dangerous when teachers give misinformation. And David, you've already mentioned that teachers sometimes see it as a taboo subject. So what kind of training do you think the teachers need in order to feel confident in delivering mental health education? And we could start with you and then move on to Monica.
I think I would say basic, but very loosely, because it's then very subjective what you'd say basic training is. But I think it's more on the fact of them kind of being made aware of the services that are out there for the young people to access. It's not necessarily saying let's train them up so that they can be a teacher, but then also they can basically diagnose a young person that comes to them and tells them they've got a problem. That's not the case, but I think it's more them being proactively aware of if a young person did come up to them and say something, in confidence, that they would like, right, these are the kind of services or provisions or routes that you need to go down to. So I think it's more kind of not necessarily training about diagnosing, but more training about how they can signpost. And through that, it's basically them learning about the services that are available for young people. So it's kind of a two-way education for the fact of, educating the teachers about the services, but who then go on to educate the young people.
I think for mental health first aid is a fab idea. With all the data we collected, I think it was Welwyn Hatfield Youth Council actually took it and offered a mental health first aid course. I think it's a really good idea because if your teacher has that, like, say if you had a science teacher, if you burn yourself in science, they're supposed to know how to deal with it. So if you're having like a problem, they should at least know where to signpost you. It's also really good because if a teacher has the mental health first aid kind of like in the bag, then they can help support young mental health champions in their school. So it kind of has lots of little benefits that all come together.
Would you want to make this mandatory education, like training for the teachers? Or
I would say no. If you make it mandatory, people will do it begrudgingly. And as has already been mentioned, it isn't the primary role of a teacher to diagnose mental health conditions, if that makes sense. Or it isn't the primary role of a teacher to look after every aspect of their young people's lives. Having said that, I would go for having education by specific teachers or by school nurses rather than by an ordinary classroom teacher who teaches maths. I just think that we use people who have maths degrees to teach maths in schools. It doesn't seem quite right for people to teach about mental health, which I think is a bit more complicated as a maths undergraduate than maths. It doesn't seem right that we just get essentially random people teaching.
Just to add on what Tom said, I think not necessarily mandatory across the board, but possibly those teachers that take kind of a pastoral care kind of role within a school, because that's kind of their remit anyway, is the kind of the well-being of the students. So I would possibly go to the extent of saying it's mandatory for them, but also kind of not necessarily for everyone.
I would say I think maybe like a 2 kind of level system would work quite well. So you'd expect every teacher in your school to know how to deal with quite like a minor physical injury, but then if there was something seriously bad, you go to your school nurse. So maybe like all teachers would have to mandatory kind of like learn how to signpost young people, but then there's specialist people within the school who have gone on for that further training so they're kind of like the experts where they can be signposted to.
I don't think it should be mandatory, however, I think everyone should, it should be widely available for teachers to have it if they need it and want it. It should be, I think it should be touched along with safeguarding and child protection. So when they do that, it also they're also informed about this to help kids if they work with them. So I don't think it should be mandatory, but it should definitely be promoted. Thank you.
Thank you. Ryan?
Both organisations I know have conducted research on this subject. So regarding awareness, how do you think that mental health awareness within young people should be improved? We'll start with David.
I think the kind of first protocol for awareness for young people is we're kind of in the age now where we don't necessarily talk when we talk online. We go online to find out anything. If you don't quite know anything, you always Google something. So I think with more awareness is kind of the promotion of websites such as NHS Choices, that kind of thing, YoungMinds, Mindful, those kind of websites that are very beneficial for young people and has proven to be quite popular. So I think more awareness is that kind of, pushing those trusted sites rather than, because on the internet, I know you can, if you type anything about mental health, there's good things and bad things. So I think it's kind of that promoting those trusted sites is kind of what we should go for.
I think it should be touched on. So with kind of social media as well, leaflets kind of going to schools. I know we've touched on PSHE as well, should be there. I think schools should do a better job in promoting mental health because I think, as you said, it is quite taboo still and it needs to be kind of widened and talked about.
I was going to say over half of the young people we spoke to favourited group discussions like informed time or assemblies and workshops and things like that. And also the vast majority said they would expect to learn about mental health and things in PSHE. So I think open discussion is a very good way to promote mental health, especially if it's in a positive way.
Thank you. Francesca?
I want to touch briefly on the stigma surrounding mental health for young people. So just expanding on this, what do you think are the best ways to involve young people specifically in an anti-stigma campaign? Thomas, do you want to start and then go to Ahmed?
Yeah, I think that the best way to engage young people in an anti-stigma campaign is to talk to them, to use Facebook and social media to ask young people what they think a good anti-stigma campaign is. I think you can perhaps train young people to be young health champions or what have you in local areas to promote anti-stigma things. I think you could run posters that have been designed by young people that go up in schools, in GP surgeries, on the internet, etc. And I think it's basically about promoting it as something that you just talk about freely, in the sense that it needs to become a topic that's no longer reserved for sort of one-to-one conversations. Clearly, you're going to talk about your own mental health in a one-to-one conversation, but you can talk generally about mental health and mental health issues on a much more wider basis. It needs to be in the news, it needs to be in across the TV networks, and just around and about the place.
I think getting young people involved with current campaigns and current groups and activities and getting feedback from them to see what is effective, what isn't effective, and not kind of starting a different group, but taking that back and looking at it, giving feedback to those groups so they can help run more of an effective campaign. For example, like the National Mental Health Week, not a lot of people know about it. It's extremely good, but it's not publicised as well as it should be. So getting young people more involved with that and kind of spreading the message by word rather than kind of posters and social media, however good they are.
If you wanted to have some fun with it and stuff, I know Ryan and Laura, we were definitely there. At the residential, we did a really peaceful protest about stigma and mental health, and people had posters and banners and were chanting. It was all very peaceful, but people were talking about it for the rest of the residential while we're there. And I think just creating a buzz and a stir and kind of getting people together is a great thing. And also, in Hertfordshire, we had a CAMS review, and 23 young people were involved, and they were from Hearts 1125, so that's youth counsellors and MYPs. So we kind of got to talk to like professionals, whether that be school nurses or counsellors or people from pastoral care. And I think having the involvement between the actual services and the young people kind of shows that there isn't a stigma, because them, like the 23 young people who went, they would all say, oh, we need to get rid of the stigma around mental health. So if they're saying it, they'll talk to their friends about it. It's definitely word of mouth and things like that.
That's great, thank you. Sophie?
On Tuesday, the House of Lords discussed mental health in young people. They've said that some policy makers are not fully recognise the effects of social media and internet pressure. What do young people want from mobile apps that could help them with mental health?
I think as was mentioned before about trusted information, we want to make sure that young people have access to good information that's correct about mental health and mental health issues. So I think some form of app that's essentially something like NHS Choices that allows you to look up different medical conditions, different mental health issues, gives you a fact finder about what they are and how they affect people, and a big button that says, here's how you contact your local XYZ that's going to help you. I think would be really helpful.
There needs to be an app, like St John's Ambulance have an app currently for first aid, and it tells you what to do if something happens and like, how to treat it. So I think there needs to be something like that for mental health, so who to contact for it, the early signs and how to treat it. That would probably be the most effective way, and kind of a simple layout, easy to understand for young people.
I think it doesn't need to be pages and pages of writing, because like when you're doing your homework and you open something, you're like, oh, I don't want to read all this. It needs to be really short and concise. I think really bright and really positive, but I would say maybe not overly graphic, because like I know for me and lots of other young people, my friend like, oh, can I borrow your phone and check this? But oh yeah, sure. You wouldn't really want someone to go on your phone and be like, oh, what's this then? And kind of, I think it needs to be quite, I can't think of the words. It does need to say, oh, you've got this, this, this and this. It needs to be like, oh, here's what you could do about this, or here's some positive things about, and other links, and definitely helplines, like you just click it and it calls it, because they're always really useful for people to talk to if you're in a bad situation.
Thank you. What do you think the government could do to reduce the impact of self-harm sites, or sites that encourage eating disorders? I'll first ask Ahmed.
I think you should completely close them down, because it is freedom of speech. However, I do think there should be a lot of pressure on these people who are running these sites to close them down, because it is bad. I think the best way to do it would kind of be with personal stories of people who are willing to share their experiences. I think that might hit home to people more, because showing kind of how traumatic it is for people, they might realise the message that these sites are bad, and they are bad for young people's mental health as well.
Thank you. And would you like to answer as well, David?
Pretty much exactly the same. I think it's kind of hard for the government to, you can't just get rid of them because it's the internet, you get rid of one and another two pop up all over there, and they're always going to be there, and young people will always find things that they want to find on the internet because it's so easily accessible. But I think it's just kind of going back to the point of kind of promoting the trusted sites, that if you are wanting to find information about certain things, that these are there's a list of sites that you should go to. And hopefully that would then stop any kind of future searching of the pro-anorexia or pro-self-harm that could then trigger them to go even further down the road that they may be travelling. So I think it's kind of just promoting and making everyone aware of trusted sites that they should go to if they ever need advice.
So would something like a kite mark system be used for some kind of rubber stamped official?
I think so. I think that would be a really good idea, and kind of then everyone would know that that particular site is something that they should be looking at. It's not going to be triggering, it's actually going to help them rather than possibly have a negative effect on them.
That's great, thank you. Laura?
Good morning, I'm Laura. Through our private evidence session with young people last week and our visit to a CAM centre yesterday, the committee has learned that exam pressure is having huge impacts on mental health with young people. So, Monica and Thomas, as students and young people yourselves, do you agree with this, and how do you think this should be tackled?
I've just finished my GCSEs recently, and I think the worst thing that I kept constantly hearing was sixth formers turning around and going, GCSEs are nothing, A-levels are so hard. I think it's really important to remember that, okay, maybe A-levels are a little bit more challenging with the content, but at that time for you it's very stressful, and that's what's going on in your life right then. And I think teachers need to be really kind of open about talking about it. Like, if you want an extra revision session, if you're not sure about something, they need to be there to like give it to you. But I also think it's really quite important to promote to young people that when you have got exams or if you've got a test coming up, you don't need to revise 24 hours a day, 7 days a week. It's really important to have a break, go to the cinema, walk your dog, ring your friend. I think it's important that you're still a young person, you still have a life, hopefully have a social life, so you can go and do that. I think it just needs to be promoted that, yep, they are your exams, they are very important, but your mental health is equally important, because if you walk into that exam and you're completely stressed out, you're going to not do as well as you could have done if you had been calm and relaxed.
Yeah, so I've just finished last week my end of first year university exams, and it worked quite well because whilst in the same position, my exams didn't count towards my degree, so everyone else who was older than me was vaguely telling me that they don't matter, which was fairly annoying at times. There was, because of the community that you have at university, and because you're all living together and all socialising together, and we all had exams at slightly different times, it meant that we all supported each other. So when you noticed that your friend was spending a ridiculous amount of time in the library trying to work, you would go and take them for a walk or something, and you just got this really nice atmosphere. And sort of coming back to sort of peer supporting things, we have quite a good peer support network at university, where I get emails every week saying so and so's in this room if you want to go and talk to them about anything, which I think works quite well for just the community feel and the feel that everyone's sort of in it together, which really helps alleviate the exam stress, because you don't feel like you're the only one going through it, and so you develop these relationships with everyone.
Yeah, just to expand on that, what role can the parents do to help the young people to have less pressure on exams? Because for some parents it might feel a bit alienated because the system's changed so much compared to their time. So you as the young people, what do you suggest as a recommendation to a parent that's probably watching this right now to support their young people when the time arrives? So this is open to anyone who wants to obviously chip in.
I think parents should mainly contact other people, ask school for advice as well, ask different parents, see what they've done. I think kind of that community spirit within a school would be quite useful for parents, just to kind of good practices with each other. I just think talking to the young person, talking to their child, probably the best way, just open up a little bit, relieve the stress. Talking to someone is really helpful in the exam season, because you just kind of lock yourself confined in a room with a bit of paper and just copying out a textbook. So I think just talking to them would be the most helpful way.
Thank you.
Yeah, positive support, so being supportive of what they're doing. It's very easy to look at what a student's doing and going, you're not doing enough, you're doing too much. It's like, no, I'm doing what I want to do. I know how much I'm doing, you probably don't. And so being supportive and saying, do you want a cup of tea? Do you want to go and walk the dog? Do you want, rather than commanding and saying, go and do this and go and do that.
To bring back to your point about the transition to university and your time at university and how your university helped you manage stress, are there any specific programs that your university first of all ran, and second of all, from the transition from, of course, going from home to university is also a transition where most people are turning 18.
Yes.
I don't know if either of your organisations have looked at this, but have any of you identified whether the transition of not just turning 18 and potentially moving from a CAMS to an AMS service, but also moving from home to a university, if universities actually provide much support for those students in that situation?
From my experience of universities, which isn't the greatest, and it's not something that I'm aware that the Youth Forum has looked at as a youth forum. Universities tend to be quite on it because of their size, and because they know that because of their size, and they know that most people have moved away from home to go and study at the university and live at the university. They tend to have fairly reasonable counselling services. You spend Freshers Week picking up leaflets, about 10% of them are like counselling services, and ring this number and blah, blah, blah. And so I think they tend to be fairly reasonable at it. What it requires, though, is it requires young people to access those services. So you still have the same problem that young people don't necessarily go and use those services, but it's fairly advertised that they're there. There are more services that I know exist that I could go and find now than there were when I was living at home.
Just to add on to what Tom said, I think it's very true going to university. Within the first couple of days, all these services of kind of mentoring schemes, befriending schemes, stuff like that, I was made much more aware of them whilst at uni than I ever was when I was at home. And just from an example at my university, we have like a kind of an M&M mentoring scheme. So it's kind of like, they're called our mum and dad. So you have older students that are kind of like your mum and dad, and you're kind of in like a little kind of random family. So you've kind of got older students that have kind of been through the same process and know exactly what you're going through, kind of, and they're kind of just there to, if you've got any questions that you might want to ask, they're there to help, and it's quite nice for my university anyway, that you build up a kind of more of a kind of friendship with the older students, and you kind of get a bit more of a better experience of university, I think, having kind of some of the older students' friends. So, but I think it's really good, and like Tom said, universities seem to be really on it when it comes to the kind of support services for their students, because they kind of recognise that moving away from home for some people is the first time they've ever been away from their families, and it can be quite a daunting and scary process for young people. So, yeah.
That's great. Thank you. And now the final question: if you could see any recommendation in our report, what one recommendation would you like to see? I'll start with Tom first, because you look quite happy about this question.
Great, thanks. I should have looked worse. So I think that I really believe that if you make mental health something that is just talked about and you remove the stigma from it, then you will solve most of the problems associated with it. Having said that, that problem in itself is it's not unsolvable, but it's fairly difficult to solve. And I think that some form of jigsaw approach that I mentioned earlier about posters, soaps, schools, scouts, cadets, all these kind of different ways of accessing young people, because you'll hit some young people twice, you'll probably still miss young people, but you're trying to get as broad a coverage as possible to educate as many young people and sort of wider society about mental health issues.
Thank you. David?
I'm going to be really cheeky. I kind of have two, just very quickly. One being, I think, kind of everyone kind of should take responsibility on kind of learning about the services that are available for young people and actually playing their part in signposting for young people. And the second one is, I think that organisations that work with young people or around mental health, I think there should be more collaboration between the different organisations. So not all the time, you're not reinventing the wheel all the time, because there's for mental health, there's so many things that have been done before. I think it's kind of how you can promote that and make more awareness of something that's already been done, rather than starting from scratch. I think there's more communication and collaboration between organisations.
Thank you.
I think getting mental health groups involved with PSHE, them running the groups rather than kind of teachers doing it, and starting from quite like a relatively young age to kind of tackle that taboo subject, make it like a normal thing to talk about in society, because we kind of have rules that we don't talk about at the moment. It's not ingrained in our society that we don't talk about things we should have. So I think getting the groups involved and kind of being more knowledgeable about the topics.
Mine's a little bit more vague than these three. I think there is enough young people who have got something to say about mental health services that they need to pin back their ears and listen. Like, you're making a report, we've got a manifesto, I'm sure these guys have loads of stuff. So like in Hertfordshire, we're hoping to change from the tier system to a 6-stage system, and they're looking for young people to rename that, and having young people at the day when they wanted to kind of like revamp CAMS was so useful, because it meant that they actually got to hear our opinions. So I think they would be silly not to listen to you guys, not to listen to us, because their service is for us. So the best people to like report back on it isn't necessarily the professional people, as fab as they are. It's kind of the people who are using the service itself.
That's great. Thank you. Thank you again ever so much for your time. And with that, I close the second panel of the day. Thank you again.
Thanks.
Of course you can. Oh, stretch my legs. My legs need to stretch. Yeah. That's fine. Yeah. COPI. I just wanted to clarify, because I think I don't understand. So I said the trouble is that we had to clarify, if that makes sense, that we get to clarify, so that's what kind of just like through questioning. What's this about? Just the one. Pardon? Did who not have lunch with us? I think you did have lunch with us. Yeah, no, I remember because I sat next to him. Just about. How do I crack? You're both in it. Oh, Laura's half cut. There you go. I've done it. Yeah. Oh God. That is not what you want to wake up in the morning. Oh gosh, we have got a big panel. The notes are getting ready. The division bells ring, so when the division bells ring, everyone will stand. It makes it a bit easier than stopping and waiting for the minute's silence.
Can you share what kind of speak to you, because I'll just let you know. So we didn't talk about this tonight. You know, the ministers might, someone might sort of say, oh, you young people, what do you think? And obviously it's like, oh, probably earlier to do. You just kind of, like, just be aware that we didn't talk about it last night.
Is that the last select committee members?
Yeah. So I'm going to have a look at that. We have this policy for arts and it's a draft. You should have over 100 paragraphs.
Should have what?
You shouldn't have over 100 paragraphs. So like this is an 82 paragraph report. All of our things were meant. You shouldn't have over 100 paragraphs. You need to say what you need to say in 100 paragraphs. Just checking if
So just make the paragraphs extra large.
got loads of it. Just about like writing concisely and using the best of the evidence and not.
So is this then, it just goes through and measures up the evidence for how much points?
So,
Yes, what it does is probably the best example. This looks like an old selective report. So what you do is you have a summary, and that sort of writes itself. That's the last thing you
Oh, okay. Yeah, nice to meet you. Yeah, actually, would you be interested in coming to chat with us about our youth engagement strategy at some point? Well done. Okay. So I've done quite a lot of work with engaging with young people in my professional life. So yeah, really good to just get the views of other stakeholders just to see what's working and what isn't working. Yeah, no, I had a little look at your website last night just to check out all the panels, see who's who. So yeah, maybe we can give you your email address or something. Yeah, of course.
If we can have your attention, please.
Yeah,
and we'll begin the third panel of the day.
You don't have to.
No.
Hello everyone. So I'm Reese Hart, I'm the chair of the Youth Select Committee. First of all, thank you very much for joining us today and for travelling down to give us your evidence. If you'd like to introduce yourselves and just say a few words about your organisation, please. If you'd like to start, Sarah.
Sure. Hello, I'm Sarah Brennan, I'm the Chief Executive of YoungMinds. YoungMinds is a UK-wide organisation that champions the good mental health of children and young people across the four nations.
Hello, and I'm Jo Loughran. I head up the Time to Change Children and People's programme, which is an anti-stigma programme. We have been running as a programme since 2007, but with a focus on children and young people's work since 2011. And we are funded by the Department of Health, Comic Relief and the Big Lottery Fund.
Hi, I'm Emma Wilson. I'm Policy Assistant at the Mental Health Foundation, and I'm here with my colleague today, Marguerite, who I will let give you a brief overview of the Mental Health Foundation.
My name is Margaret Regan. I'm the Policy Manager at the Mental Health Foundation. We're a charity that's been around since the 1940s, working on mental health, learning disabilities and dementia, working across policy, research and campaigning and service development.
My name is Hackett. I'm the Chief Executive Officer of Digital Label. We're one of the largest anti-bullying charities in the country. We do a lot of work with young people aged between 13 to 25. The majority of our interventions are based digitally online, and we also do quite a lot within the area of stigma attached to bullying and mental health.
Thank you. Just to inform everyone that at 12 o'clock, so noon, I will be pausing the session for a minute to hold a minute's silence for those who were killed in the Tunisian beach attack. The division bells of the lobby will ring, so when they ring, can everyone just please just stand up, and then I'll sit everyone after the minute's silence. Thank you. But again, thank you very much for joining us. The first question I'd like to ask, and if you just give us a very few words about it, is at current, what would you say is the current status or standards of mental health services provided to young people? If you'd like to start, Liam.
Personally, I would argue that they haven't really evolved so much with regards to technology. I mean, Digital Label, we do a lot of our interventions digitally, and we know that that's how young people currently communicate. I mean, if you ask a 13, 14-year-old to pick up the phone and speak to somebody, it's not necessarily the most comfortable thing for them to do. So I would argue that mental health support, by large, is kind of a few years behind the current trends of young people. I think it's very important that we really do bring it up to scratch and bring it to modern day communication for young people.
Thank you.
It's our focus and belief that all the focus has been on service delivery at the moment for people with mental health problems, and prevention has just not been prioritised. and the mental health problems are one of the biggest public health issues that are facing us, and there's just no money or interest in prevention, and we think that focus needs to change upstream if we're going to have any chance of targeting and supporting people's mental health and well-being.
Thank you.
One thing I'll just add to that is the lack of resources that obviously are going into CAMS at the moment, given that 6% of the mental health budget is currently going onto CAMS services, and the fact that 50% of mental health problems start by the age of 14. There's just something not quite working in terms of early intervention and trying to prevent these conditions from going into adulthood. Secondly, I'd say that there needs to be a nationwide measure of funding in CAMS. It's currently not known how much is being spent in each local authority, and it's very much of a postcode lottery a lot of the time in terms of where the funding is going and which local authorities are providing more funding for CAMS. So.
Thank you.
And for Time to Change, we're not particularly about service improvement, but what we would say is that any anti-stigma programme must sit hand in hand with good and accessible services for young people in order to make sure that we are getting everybody talking about mental health and then having somewhere for young people to go and access services.
And what many people say is that the Service for Children and Young People is a broken system. The funding is 0.6% of the total NHS budget, 6% of the mental health budget. So funds are spent on long-term and crisis care, mainly of adults, very little going to children and young people. Absolutely right about the cuts in early intervention. Local authorities' cuts in the recent years, our freedom of information question that YoungMinds has carried out every year has shown year-on-year cuts, in particular to those early intervention services, often called Tier 2, these confusing tier services. We are also seeing young people with increasing amounts of mental health problems. So there is something happening around the pressures on young people today, and yet they're not able to find the services and help they need. And this is causing, when they go to get help, there's huge long waiting lists, sometimes up to 6 months, and or even longer sometimes. And it means that what we're saying to young people is, you're not sick enough yet. And so what we are leaving young people to do is get more and more seriously ill before any help is given to them. And so we're also seeing a crisis in that higher end of services where severe illnesses are. And there still isn't access. There's a huge bulge there, and services aren't able to respond. So we're seeing some very serious issues, but there is also help with the new report that's come through and recommendations from Future in Mind, and some funds that have been agreed. Our concern is that they might not even stopgap the cuts that have happened over the last 5 years.
Thank you. Regan?
Hiya, welcome to Select Committee. The first topic that we will be covering is about reducing stigma. We know that Time to Change is submitted to us, and Digital Labour have also said 45% of young people failed to report bullying through embarrassment, fear and lack of support system. So my question to Digital Labour and also Time to Change is, can you describe the impact of stigma around mental health on young people? And can I start with you, Liam, please?
Yeah, of course. Well, I think stigma starts from day zero, doesn't it, really? Because it's so heavily embedded within our society, because we're brought up to see mental health as something that's scary and something that we shouldn't really talk about. I mean, when you think about horror films, how many have we seen that are based in mental asylums, for example? And I think stigma is a huge barrier to entry for a lot of young people, and it's not just surrounding mental health, but it's associated problems as well. And I think that has really massive implications because, I mean, as we'll all know, when you're going through a stressful situation and you keep it to yourself, it becomes increasingly difficult to deal with. And I think it has huge implications on mental health issues. I mean, we found that as a result of bullying, for example, 1 in 3 had self-harmed, which is incredibly serious, and it's an alarming rate. But also equally, we found that 14% have developed eating disorders, and we really need to get away from this, away from the stigmas, to encourage young people to not necessarily see it as a mental health issue, but actually a health issue, and I think that's really, really important.
Thank you. Yianni?
Hello, my name's Ewan. Liam, you've mentioned in Digital Label that often the media, pop culture, movies and other forms of entertainment villainise mental health. So I was wondering, what is the impact of the media on public perceptions of mental health? And if we could start with you and then Sarah.
Well, I think it's significant because, you know, we're conditioned from, as I said, from childhood to see mental health as something scary and as something that we should all be afraid of. And, you know, it's very interesting because as a society, there are fragments of society who like to be very proactive about it and talk openly about it, but actually we see a lot of people are very quiet about mental health issues, and certainly within workplaces as well. And I think it really does have significant impacts, and the media really does have a huge role to play, and especially with the rise of digital technology, because it's very difficult to regulate the things that are going out on social media and independent websites as well. And it just completely normalises certain attitudes and behaviours for young people. So yeah, I would say it's significant.
Thank you.
For us, I would say that stigma actually affects everywhere. So in school, for instance, teachers are often very, very worried about how they might help and scared about doing something wrong, as well as about getting involved, and say to us, we want health services to sort out this young person. It's not for us. And also then in school, the stigma continues. So. For instance, when young people then have to go to a clinic to see a therapist in the daytime, they're then seen as being truanting from school or taking themselves out. If they're finding school difficult, then they're seen as being a difficult pupil or a difficult young person. So, and then on top of that, we have how people actually relate to young people at all. So we did a survey with professionals around young people and self-harming, and GPs didn't know how to talk to this teenager sitting in front of them, let alone broach the subject around mental health problems and in particular self-harm, because the whole stigma around that as well. And so how young people are also treated in the system is riddled with stigma as well. Stigma around mental health and particular issues. So self-harm, young people who end up at A&E because of how they're feeling and harming themselves, can then really experience bad stigma from those professionals because there is the shame attached to it and actually make the situation worse. So it's riddled throughout the system, as I think, as Time to Change has really known and has done some work around raising awareness that this is something that happens to everybody. We've all got mental health, and we all have times when we need help and support around it.
Do you think there's anything the media could do to help combat stigma and be in the anti-stigma campaign?
Definitely. We have seen a big change since I've been at YoungMinds. When I first started, we tried to get media attention to this because we felt like that's oxygen and it will, grow people's awareness. And no media was interested at all. And now we are overwhelmed by calls for stories, for media coverage. And interestingly, who the media want to hear from are young people. They want young people's stories, and that's what really changes how the public perceives this and recognises that this could be my daughter or my son, or this could be my friend, or this could be me. And I think what was being said about normalising it is really important, and what we need more of is young people celebrities prepared to say, I've had depression, I suffer with anxiety, because that's what really shifts for other young people, that this isn't something I've got to be ashamed of. This is something that happens to us, and that's what we'd like to see more of. But yes, the media are very important.
I was just going to say that I think the media has a significant role to play in terms of encouraging dialogue, and in the media it's so heavily emphasised physical health, and we never talk about mental health, and we need to be encouraging more people talking about it. And also just off the back of what was just said about it with regards to celebrities, I mean, we work a lot with celebrities and online influencers, and we find that's a very powerful dialogue with young people, because it normalises it and it makes the subject a lot more approachable. And I think there's a lot of power to be had with successful media campaigns.
Thanks.
Just to go back to the original question, in terms of impact of stigma and discrimination, if that's okay. Just to give that some context for you, in a report that we did with about 1,000 young people aged 14 to 18, we know that 9 out of 10 of those young people that we spoke to said they'd experienced mental health stigma and discrimination. I mean, that's outrageous, really, isn't it? It's an enormous amount. And 44% of those said it was happening on a weekly or a monthly or a daily basis. And when we think about impact, it's got a massive, massive impact. Young people have stopped going to school. 40% said they'd stopped going to school. That has massive impacts on their future lives. We also know that a third of the people we spoke to said that negative reactions from others made them want to give up on life. That's a real damning state of affairs for our culture right now. So it's also the fear of stigma and discrimination, whether you've experienced it or not, or whether actually you're just worried about the fact that if you talk about it you might be treated differently, has been another really big thing. It's also stopped young people, 57% of those we talked to, from applying for jobs or taking up a university space. So that just gives you some context in terms of the impact that experiencing stigma and discrimination has on young people's lives. In terms of the media question, I agree with both of my colleagues. You know, we've for many individuals, both young people and adults, one of the main places they might get some of their information about mental health will be through media, whether that be through reporting in newspapers or through soaps. So we've almost tried to take control back of that by working with newspapers, by working with soaps, to make sure that we are addressing positive and accurate representations of what it feels like to be experiencing a mental health problem. And we've had much response from that. I will point out a report that we did called Making a Drama Out of a Crisis, which I won't go into great detail about now, but I can certainly send that through to you to inform your report. And the media really has positive and negative. One of the positives is that it helps us to reach a really large number of people with messages that we know inspire people to start talking about mental health as a topic. So it has both positive and both negative connotations.
Thank you.
What evidence have you seen of the link between mental health stigma and bullying? This question's for YoungMinds and the Mental Health Foundation.
It has an enormous connection. So what we see time and again, so we have bullying as being, and as we've already been hearing about, a 24/7 access, and I think that's the real change with social media. And what bullying focuses on is when a young person is different in any way, shape or form. And when a young person is feeling anxious or depressed or anything that isn't absolutely fitting into what that particular gang or culture or is seen as okay, they are vulnerable for bullying. It is something that can be used and mined, if you like, and used against them. The trouble is, the impact of that can be multiplied and amplified, because if you are feeling anxious, depressed, vulnerable at all, then the bullying has a far bigger effect than if you are feeling resilient and strong. So there is a direct connection between the two because of the stigma around mental health, because of the lack of understanding, and because it presents an opportunity to for the bully to feel powerful and have a go. And I think what young people have told us has been really helpful for them is making contact with other young people who are having similar experiences. So how do you counteract that sense of vulnerability? You need to build resilience, and part of building resilience is actually having a sense of belonging and having a sense of friendship, and that you are valued and you're okay. So the peer support around that is incredibly useful and powerful. And the youth engagement work that we've done with now thousands of young people, one of the real benefits that those young people have told us is that it's been life-changing just because of that engagement and that involvement. meeting other young people, being able to be who they are, being able to be open about what's going on for them, and then learning new skills. So the development of self-esteem, self-confidence, but also leadership skills, talking to the media, public speaking like you're doing here, has really helped them build their emotional resilience too. Does that answer your question?
We'll hear from Liam as well on this question.
Well, we do a benchmark survey every single year in partnership with schools and colleges across the country to identify the current landscape of bullying. And the reason we do that is because it's important for us as a youth organisation to continue to innovate and to continue to forecast future trends. What we consistently find every single year, that students who report mental health issues are far more likely to experience bullying than those without. And we find that's consistent with anybody who has any sort of disability as well. And I think it's important that we don't overlook the mental health implications of perpetrators, because a lot of the work that goes on is very reactive in terms of how do we support the victims of bullying, but actually we're not looking at the root cause of the issue. And we know from our work at Ditch the Label that often people bully others because they're going through a traumatic situation themselves and they feel very bad about who they are as people. So actually, if we go to the root of that issue and understand the cause and effect of the bullying, we can actually orientate more of our support interventions towards the perpetrators of the bullying. And I think that's really important because, you know, we live in a society where people who do bully are so massively villainised. So it makes it very difficult for them to stand up and say, look, do you know what, I have a problem, I need help. Which is why we found that those who do bullying are far more likely to engage in crime and far more likely to have negative mental health. So I would say there's a very strong correlation between bullying and mental health. And also we recently just released a new report which is all about appearance-based bullying, and we found that 45% of young people now want to change how they look. And that has huge implications on mental health because children as young as 13 now want breast enlargements and acid facial peels and Botox. And we're finding that young people are increasingly objectifying themselves, which is incredibly scary.
Thank you.
Thank you. As charities, you'll currently run campaigns to either raise awareness or reduce stigma. Could I ask Ditch the Label, Mental Health Foundation and Time to Change to explain their current campaigns?
So we recently ran a campaign with one of our digital delivery partners called Habbo Hotel. And for anybody who isn't familiar with Habbo, it's a virtual platform where people go on and create a little virtual character and explore this virtual world. And the reason why it works so fantastically is because you often find that young people on platforms like Habbo and other social games are projecting their ideal self, they're projecting who they want to be in a totally anonymous, safe way. So we've been working with Habbo for 2 years now, and it's very powerful because we're engaging with young people in a really authentic touch point where they actually feel like they can reach out to support without any of that stigma attached. So we recently ran a campaign for Mental Health Awareness Week. And essentially what we were doing, we created virtual rooms on the platform, and we had a lot of promotional materials to actually highlight the fact that mental health is no different to physical health, and a lot of mental health issues can be treated with the right kind of interventions. We also provided a lot of support in-game as well, and as a result of that 2-week campaign, we actually engaged with over 100,000 young people. In addition, we ran social media campaigns, which was designed to break down these stigmas and this disassociation from mental health and physical health. And we had 1.2 million people who actually viewed that content over the 2-week period as well. So it enabled us to reach a massive audience. And actually, it was great in terms of bringing down those barriers and actually encouraging young people to discuss mental health in a very different way. We purposely didn't use the term mental health because we know from our research a lot of young people have preconceived ideas of what mental health means. So we actually just stepped away from that and looked at emotions, behaviours, and we use that as our lead-in with young people.
So the Mental Health Foundation is UK-wide, and we have a huge anti-stigma campaign in Scotland called See Me, which we started working on 2 years ago with SAMH. It's actually been running for 12 years. It's a rights-based approach, and it's about increasing mental health literacy in population, because it's our belief that if you increase mental health literacy, you can have a direct effect on stigma, on bullying, and discrimination. So it's quite a large project, and they work with the workforce, and they also work with young people. In the area of young people, one of the tools they've created is a resource called What's on Your Mind, which is a peer education pack that young people can bring into their classroom or their group and run activities to introduce the topic of mental health to their class. Like, one of the ideas is, I think it's called this, I probably have it in my notes, status update, and it's taking the idea of, if you see something on Twitter, somebody's a cry for help, how would you support that person? So it's about developing a message of support for somebody who is obviously having a mental health crisis. So there's lots of other activities. I think there's between 16 and 20 of them. They're all online if you just search See Change, See Me. But yeah, so that's what our big work is on anti-stigma.
And I'll also just pick up on what Marguerite said as well. One of our colleagues earlier was speaking about the importance of peer education and breaking down stigma through peer mentoring, that sort of thing. And one of the collaborative programs we're hoping to have in the next few years is going to be a peer education project that will be working with schools, and it'll be co-production of Year 12 students working with some of the facilitators to try and build up a school curriculum program where Year 12 students can work with Year 7 students and talk about the issues that the Year 12 students co-produce, the big issues that they feel that should be discussed at an earlier age. And the second point is the importance of breaking down stigma must start at an early age. So to prevent the stigma from arising, you need to get involved with primary school education. It's not just going into the schools in secondary education, because by that point stigma is often embedded into the culture. So it's about talking to young people even from the age of 5, talking about the importance of saying, this is how I'm feeling, and if they're being bullied at school, going back to the previous point, it's about having that adult that can be spoken to. Is about working systemically as well, working in the community, working with parents, working with other agencies that work with young people. So it's a multi-agency approach in order to combat the stigma that does then later present, with 50% of young people at the age of 14 who have those long-term conditions.
Thank you. We'll pause in a minute for the minute silence. I ask that no tweets be sent out or no other communications be sent. But again, you'll hear the division bells ring. If you'd like to continue.
Sorry, Jo.
Okay, thank you. So, Time to Change, as I said at the beginning, we've been working with an adult audience since 2007, but our youth programme since 2011 has been 2 pilots. So we've been testing it in 2 areas of the country to figure out what elements need to be part of a programme that makes a successful anti-stigma programme to get young people thinking about their knowledge, their attitudes and their behaviour. So we are a behaviour change programme. We're also about a social movement, so everything that we do has the involvement of our stakeholders, and by that we mean individuals with personal experience of mental health problems. So for our children and people, we have trained social leaders who go out and do media appearances for us or would sit on a committee like this. They also work with us to give any feedback into what we're doing, and they co-train with us. They co-train other stakeholders with us as well. We have a multi-faceted, multi-level programme of work, and we've always had it as an evidence-based programme. So we've looked at what works, and we've also looked at what works internationally and made sure that we're replicating those things that do and not trying to reinvent the wheel. Our audiences are 14 to 18-year-olds, so secondary school, but I totally agree with you that we really need to be starting to think about this sort of stuff at age 5 really onwards. Everything we do is insights-based, so we understand where young people are now and where we want them to go in terms of their knowledge, attitudes and behaviour. We are working with the 9 in 10 to target the 9 in 10. So if 1 in 10 young people have experienced a mental health problem, our target audience is trying to talk to those 9 in 10, but using the personal experience of that 1 in 10 to get our messages across. At the moment, we've done lots of work in schools. That's been our most successful area right now. And we've created a suite of tools that can be used along with toolkits, so that if we don't have your intervention with us as a team, you're able to download something that will enable you to run a programme and have all of the tools that you might need to deliver that. We've also been working with community groups and youth work groups as well, and one of the things that we know really well is that actually the messages being delivered, young people want those to be people that they know and trust, and they need to be, so lots of the peer-to-peer stuff that we've been talking about The big noise that we make is social marketing, so you may have seen some of our vlogs, for example. We commissioned some bloggers to do some work on mental health, and also some of the TV adverts you'll have seen from the adult programme as well. So it's a really sort of, national noise plus some activity that happens on the ground, most of which at the moment is working in secondary schools.
Thank you.
Before we continue, I'll pause this just for a moment just before the bells ring, because I feel like they'll be going off soon, so I won't let any questions start to be interrupted halfway through. Should be sometime soon. What's that, please? May sit. Thank you. Francesca, if you'd like to begin.
So we're going to now go on to the area of education. So a lot of the evidence we've received from witnesses argues that schools are the best venue to fight the stigma. And so within this, I'd like to ask, how can schools help to battle stigma around mental health? And in particular, what should schools teach and at what age? If I can go to YoungMinds and then to Time for Change.
I know Joe will talk about stigma itself with Time to Change work. So can I focus on something slightly different, which is I think is the broader thing around how do schools actually do something positive around stigma and children and young people's mental health? And I think that's about how do schools actually help build resilience for children and young people. So it's not just about academic work, it is also actually about who we are as people. And if schools are doing that and are actually making it very public around how we look after ourselves emotionally, not just physically, then it will naturally flow through that stigma will be challenged, because it will just become a normal thing that we're just looking after our mental health. We can talk about when we don't feel good, and we can also talk about the impact of things happening in our lives, whether that's bullying, whether that's a bereavement, whatever it is. And I think that's where YoungMinds is really wanting to push schools. So what we want to see happening, besides raising awareness, but is also that schools really take on building emotional resilience, and that happens across the whole school. It isn't having lots of people talk about having mental health taught in the PSHE lessons, and that becomes compulsory. That would be good, but that's only one small element. What we're very interested in is schools thinking about how their whole pupil population is in terms of resilience, not just in terms of academic performance. And one of the things we say to schools is that this actually has an impact on how you perform academically as well. And the research shows that there is a direct correlation between the experience of being at school about resilience and certainly attendance. It's less clear around actual attainment as yet, mainly because the research hasn't been done, but certainly around attainment. And that what schools need to think about is also resilience of the teachers as well, because if you're going to have a system that is healthy, and emotionally healthy, the people who are doing that have to also have that awareness for themselves and look after themselves. And there's all sorts of things that schools can do. It isn't just one thing. And I think that is the danger, is that sometimes people think, oh right, there should be a counsellor in every school, or we just need to have it taught in PhD lessons. And that isn't the answer. Schools need to have a whole school approach, so that we are looking at things in all sorts of different ways. And we do a lot of work with schools, and there are a lot of schools who are very interested in this and really see the benefits and see a whole sea change happen. So that, I think, is how stigma can be properly challenged. And we don't want to challenge just stigma. We need to think of that as part of everything all the time.
Thank you. And also for us, I mean, I totally agree with everything you've said, really. And I think, so just to give some context to that as well, in terms of the work that we do in schools, is one part of the whole of what Time to Change do and what our colleagues here do as well. And I think that's quite an important distinction to make. So it's not just that something's happening in the school and only in the school and in isolation, but that it's happening in the rest of the world that young person sees. So if we take the young person at the centre, they're impacted by what their parents might think or feel, they're impacted by what their peers might think or feel, and so it goes on. So the context of what we deliver within a school setting sits within a larger Time to Change programme. In terms of what we've been doing with working with schools, we've gone in and tried to, as much as possible, give the emphasis over to schools to run this programme with assistance from us on their own, because we never know how long something like Time to Change might be around, and it's really important that schools feel ownership of what it is that they're delivering. So what we've suggested that they do is that they start by creating a forum, a panel of young people who will work with a dedicated teacher to deliver a programme, a campaign within their school, but that's run and led by young people. That they can use some of the materials that we have if they find those particularly useful, and also to be able to deliver programmes that fit within the curriculum. So that's why it has to be flexible to be able to be delivered in schools, because let's face it, schools are very busy places. Everybody wants to go there to get their messages across, but we also know that that's where we have a captive audience. So it's the best place for us to be working. We've put together with schools an action plan so that they can literally see at a glance when they might deliver things, when there'll be national pieces of work happening through Time to Change, and how they might use that as a hook to deliver programmes of work that fit in with the existing criteria. Again, I would definitely agree, we see this as a whole school approach. So in terms of in what subject areas, I would say that you could find a way to open up the conversation about mental health in every curriculum subject. And we really just want to make talking about the topic of mental health everyday and ordinary, because we know it is everyday and ordinary. And so really it's a campaign that allows people to talk about it and to feel comfortable, so that if they do need to disclose, if there are some problems that they're experiencing, that they can do so without fear of stigma and discrimination.
Can I just add another thing? What I didn't mention, stupidly, is that we have a program that we've termed it academic resilience. It is resilience, but by putting the word academic in it, it means that schools feel like it's about them, which has been good. And it's based on research from Brighton University, and we've developed it for schools, and we're now doing that across about 60 schools in the country. And we're evaluating it as well, because we're wanting to build the evidence around this area, because it is still quite thin. And in those schools, there is a real welcome, because there are what we also find is the head teachers being really concerned themselves, in some schools, not all schools, but there are in many schools, about what's happening in their schools, and they're at a loss to know what to do. And so academic resilience, it's a flexible programme, and schools can make it, bespoke it for themselves, and they really like that as well, because every school is different, and they also do see themselves as being a bit of a community of their own. So, and I think that's what we need to think about when we're thinking about schools, is how we give them the tools, but we don't dictate.
Mm-hmm. Thank you.
Thank you. Ryan?
Yeah, hello. This question is for Liam. How can schools and other organisations help parents to discuss and support mental health of their child?
Well, we get approached by a lot of parents and guardians who just don't know how to approach these issues with their children, especially with cyberbullying and sexting and all that whole entire digital realm of things. And I think there's definitely a disconnect between a lot of parents and guardians and their children, because they just simply just don't know how to even approach it, and often they may not even know that there's something going on. So I think it's important that we not just look at training teachers in this and young people, but also looking at the training that we provide to parents and guardians and making sure that they're supported in this process as well, because it can be really stressful for parents and guardians, especially if they feel like they're going through it alone, or perhaps they're not getting the support that they should be getting. So I think we all have a responsibility within society to be talking about these issues. And I mean, we have a lot of guidance on our website for parents and guardians, not specifically for mental health issues, but just for the whole realm of bullying. So I'd say that needs to be done on an ongoing basis. And I think with digital technology, it has such a large implication upon the mental health of young people and the ideas of self and how they perceive other people as well. And I think it's a ball that keeps rolling, essentially, because there's new apps coming out on the App Store every day. There's constantly new social media outlets, and it becomes very difficult for parents and guardians to keep up with that.
Thank you.
Thank you. Terence?
Hi, Terence. This question is directly specific to Sarah, and the question is, could you describe a whole school approach to mental health, and what would it involve?
Okay, so I just started started on that. What we mean by a whole school approach is that, and we've connected that now with our academic resilience work, is that you need the leadership team to really take on that this is important to start with. So the head teacher, the deputy head, and often it's the inclusion lead within the school are key people. And that then there is, what we've done is go into schools and do some training initially around developing their awareness about this. And so what happens is, first of all, thinking of the things that Jo was saying about how they might introduce mental health awareness within different parts of the curriculum. How they can think about times in the day when, and whether it's in a primary school or secondary school, when their pupils might be feeling, or the ones who are vulnerable, feeling particularly vulnerable. One school that we work with, they said what happens is at playtime is when those young people who haven't got such a peer group feel particularly isolated. So what they did was think about how can they change that. And they introduced, at the end of lunch break, they introduced Zumba and brain gym as a way of getting everyone together and having some fun, but having physical activity, getting rid of stresses, strains, or whatever that's built up, but then also focusing the mind back down again, so that when they come into class afterwards, they feel relaxed, they're ready to focus, sit quietly, concentrate. Having school counsellors, but thinking about that sort of differently. So how might the pupils want to engage with those counsellors? So schools have had suggestion boxes, or they've worked in groups rather than individuals. So because otherwise you can only see a very few number of pupils. And other things like introducing mindfulness at the beginning of lessons. So again, helping pupils just focus and settle. Thinking about this in primary schools in particular, just the ideas coming to my mind. When a young person, being able to identify young people who are, maybe their behaviour has changed, something is different, and the teacher having some tools in their toolbox around how they might respond to that, giving them the confidence to actually start a conversation with pupils that doesn't put them on the back foot. So giving staff the tools to actually start that conversation and know what to say. And one of the sets of skills we've given in primary school is about how in literacy we can use doing story writing as a way for pupils who are having trouble to be able to talk about their emotional troubles, but as a story, so they can be talking about dragons, but actually it's giving them a way of expressing what's going on for them, and doing that with a parent, so it's a very safe way for the parent to find out what's going on with their child. So it's a whole range of things, and it is having the policies as well. It is having the anti-bullying policy, but it's in really thinking about how does that play out in the school. And one of the other things we've helped schools do is think about how do you assess the resilience of your pupils? How do you spot when someone's having difficulties or have got particular risks at the moment? And so we help schools do an audit of about mental health and risks within their school, so they can identify who might be most at risk at any time. So it might be all sorts of things. It might be things going on at home, it might be a bereavement, it might be somebody who finds exams very difficult. But it then means the teachers know who is most at risk at the moment, who should I be aware of, so that they actually manage their behaviour a bit with those young people, so that if they see them in the corridor, they give them a smile and say hi. Some of those really simple things actually make a big difference to how the pupils feel in school and what that experience is like in school. It's also having ways of having the pupils themselves being active. So like the peer mentoring project talked about here for year 12 to year 7, that's being done in a number of schools around that mentoring. That's another mechanism. So it's enabling schools to have a whole kind of menu of different things that they're doing at all sorts of different levels across the school, so that they are being positive and giving out positive messages around that to make sure that everyone knows that this is good and this is okay. Does that kind of describe it okay?
Yeah. Thank you.
I just add something there for community where
yeah, I'm just going to ask you to be brief because we've got 5 more questions, but thank you.
No, it's just that we're very supportive of the whole school approach, but it's worth bearing in mind that there are children, vulnerable groups of children, homeless children, children in detention centres, looked after children who are less likely to be enrolled in schools and are also more likely to be exposed to factors that can cause them to develop mental health problems. So by putting all the emphasis on a whole school approach, you might actually miss out on a group of young people who do need much more support. So any work done needs to also involve working with local authorities to make sure that these vulnerable people are also supported, because they mightn't get the support through schools. So it's just something to bear in mind.
Thank you. I'm now going to pass on to Saskia, but we do have a few more questions, so if you could just keep your answers as brief as possible so we could get as much information as possible. But this is great, thank you ever so much. Saskia.
This is for Emma. So I know you just mentioned you're a big supporter of the whole schools approach, and you developed a teacher training programme, I think. So how can schools provide early interventions most effectively and help prevent mental illness?
I mean, as I mentioned before, it's about working out what young people want. So you have to have discussion groups with young people, work out what it is that's really troubling them, and working out what they would have liked in hindsight when they were growing up. You know, what would they have liked to have seen in primary school, secondary school education. You know, it's difficult for someone to know what is going on in a young person's head because things are changing all the time. You've got the role of technology now, which is something we'll discuss a bit later. The other issue is about the way things are taught as well. It's so important for things that are on the curriculum to be taught in an engaging way, because you're not going to prevent mental health problems if a child is sat in the classroom and they've switched off, because it's not a tick boxing exercise the way that things are, should be taught in the classroom. It's about having that teacher, that person who comes in is very engaging, understands what it is to have a mental health, or has an understanding of young people's mental well-being. So the way that things are taught is also very important. So in terms of from a young age, being taught about how to solve problems, how to deal with life setbacks, managing emotions, that sort of thing. Young people with anxiety in childhood are 3.5 times more likely to then take that on into adulthood. So it's about having those tailored curriculum points which actually address the key issues, and working with young people is the best way to do that, to work out what should be on the curriculum.
Thank you. I just want to reiterate the committee's thanks for coming in. Thank you. Ditch the label, Liam, you've submitted evidence regarding your view of social media. YoungMinds also have submitted evidence regarding mobile applications and social media too. My question is, how can online services and social media be used to promote awareness and engage young people with mental health issues? And can you describe the approaches that you have found to be particularly successful?
Well, I think young people are so massively immersed in technology, so it's a direct communication channel with them. And I would argue that digital interventions can be very, very effective. I mean, Digital Label is launched on that premise of providing digital support to young people, and I think it provides a massive opportunity with regards to breaking down stigmas and breaking down those perceived barriers to access and support. And as I said earlier, a lot of young people, they just are so terrified about picking up the phone to phone a helpline because, you know, they've been born with a smartphone in their hands and that's how they know to engage. They're all complete digital natives. And I think, you know, Digital Label, we're built around being a brand that young people feel like they can relate to and is authentic. I mean, we purposely don't have the word bullying in our name because there's so much stigma attached to it, and we want to encourage more young people to reach out for that support. And I think there's a lot to be said for, you know, effective branding of interventions. But I mean, you know, digital technology provides a lot of really intricate opportunity to massively target your support services to young people, and certainly with things like mental health, a lot of young people find it really difficult to articulate how they are feeling. So one thing that we do is we have a quite complex algorithm of keyword matching and targeting that we use to promote our services. So for example, if we have a piece of guidance on you know, mental health, we would try and look at what the behaviours and emotions attached to that are, so then we can target those keywords on search engines when young people are searching for them, and we can position our interventions direct to the young person. And also, you know, we found a lot of value in creating content that is visual and attractive and interactive, because, you know, retention is very low for people who are online. You know, there's a massive rise in video content, specifically videos that are shorter than 3 minutes in terms of building that retention. But also, we work very closely with online influencers, and I think that's a very strong value proposition for young people because it actually extends our touch points with young people into an environment that, you know, influencers have a lot of power and control online in terms of that perception and stigma change, and I think that's a really important factor. And we've built up a very strong profile on social media, and essentially what we're able to do that is normalise attitudes and behaviours and encourage more young people to reach out for support. But we also, what we do is we invest in a lot of content that isn't necessarily to do with mental health or with bullying, and it's more about tapping into the psyche of young people. So for example, we recently published an article which is all about how to know if you're addicted to emoji on your smartphone. And the reason we put stuff out like that is because it really draws a lot of young people in. Now, not all of those people are going to be looking for anti-bullying support, but a small percentage of them will do. And what that enables us to do is engage with young people who wouldn't otherwise reach out for that support, because underreporting is a massive issue within bullying. 50% who do get bullied never tell anybody. So I think digital technology really does provide a massive platform and so many great opportunities. And I think, you know, 69% of young people have been cyberbullied. It's huge. There's a lot of stuff going on online, and if you can position your intervention services within that environment, it makes it far more accessible and authentic for young people to access that support.
Thank you. Laura?
Hi, Laura. Liam just mentioned cyberbullying there. So, Joe, in relation to mental health, do you think cyberbullying has a greater impact than other types of bullying? And what do you think would reduce the prevalence of cyberbullying amongst young people?
I think that bullying in any of its forms is impactful. So the fact that we've now moved on in this modern time to be able to have a different form of bullying, the impacts are the same in terms of mental health and the impact on that. In terms of what can be done to kind of help that, I think probably my colleague Sarah or indeed Digital Label might be in a better position to be able to kind of answer that specifically for you. So maybe I could hand over to Sarah on that.
Sure. And this is about what helps, what might help.
What would help reduce the rise of cyberbullying?
I think it goes back again to, I'm sorry to repeat myself, but it is about resilience, and it is about and also young people knowing how they can look after themselves online. And this is something that we put forward to both the Health Select Committee and came out in the Mental Health Task Force. And indeed also the safer internet use around how young people can look after themselves online. And that's, I think, one of the things. We were talking about it in the office, and it said, well, for many young people, they don't see it as problematic because it's normal. It's what. So in some ways, it's all about raising awareness about there are things you can do to actually empower yourself around not letting that access, find you, but also then how you respond to it afterwards.
Briefly. So we found a direct correlation between cyberbullying and mental health. And what you find with young people who are being bullied, they tend to use the internet for escapism, so they consume it a lot more. And often they use it to project their ideal self of who they want to be. And I think it's incredibly traumatic to have this ideal self-projection to be targeted by people online. And also, one of the complexities of cyberbullying is the fact that it happens in safe places. So it happens in the home or the bedroom, which essentially infiltrates that sense of security, which has huge implications. There was a study recently, actually, which they essentially installed a plugin onto a social media network. And what they did was they scanned every single piece of content that was posted out there for an idea of sentiment and for certain keywords. So if somebody was about to post a negative comment or a negative message which could be deemed as abusive, what the app actually did was it said, look, this comment could be seen as abusive. Are you sure you really want to post it? And it gave them an 8-second lag between that comment actually going live, and it gave them that escape route. And what they found was 80% of young people then counteracted their comment, which had a massive implication on the rates of cyberbullying. And I think there really needs to be a lot more innovation going on, because we're relying on self-reporting. And, we found that there is a huge dissatisfaction with reporting on key social media outlets. I mean, we recently did a survey of over 10,000 young people and find that 7 in 10 of them had experienced bullying, and underreporting was a huge, huge issue. And I think, we all have a duty of care to young people, and it is a societal issue, but I think social networks definitely should be investing a lot more into research and development and innovation of how they're actually proactively monitoring this and disencouraging it. And also I think we need to be orientating a lot of support towards perpetrators, because as I said, they're the root of the bullying, and it's a far more effective strategy.
Just to say that there is a strand of work that's just started with the Department of Health, coming out of the Mental Health Task Force report, Future in Mind, around a digital portal for young people to access mental health help online. And I think that would be something that we all need to be engaged with. And that in a survey for the task force of 1,000 young people, what the response from young people was that finding mental health support online or anything about mental health was really difficult. There was lots on drugs, lots on physical health, hardly anything about mental health.
Again.
Again. Obviously, with the reports that we've received from especially Mental Health Foundation and also YoungMinds, it's obvious that you've conducted a research which showed that the services are under pressure, and I'm pretty sure everybody is aware of that. But there's a lack of local data, which makes it extremely difficult to know where the deep cuts have suffered the areas most. So, Mental Health Foundation, you specify that in your report. So, is it possible for you to elaborate on that a bit more for us, if that's possible?
Actually, there was one of my colleagues on the way out, the head of the children and young people. He actually has done he did some look using the child health outcome profile at services in the southwest, and they were looking at there's been huge cuts to funding in the southwest region, and if you then look at the admissions to hospital for self-harm from 2010-2011 compared to 2013-2014, in 13 of the 15 local authorities there's been higher levels of admission than average. So that's just one example. Like, you have to delve in to find this information. Like, that was him just doing some research based on, I think it was somebody had gone in contact with us, worried about the lack of services. But there's a clear lack of information out there and transparency, and that's one thing that's a big problem for us. So we don't know how much spending is actually happening when you work down. And it's very easy for the government to say, we're reinvesting 1.25 billion in mental health services, but when you actually look at what that is in real terms, it's not going to bring us back to the rate of spending there was before the cuts happened. And that's the reality of it. So unfortunately, and then on the flip side of that, you have people calling on CAMS to, give better services, to coordinate better with other areas. CAMS should be working with schools. They're not in a position to do that because they're under-resourced, and it's not fair to be putting that pressure on them because they don't have the resources in place. So the first thing that needs to happen is, we think that funding needs to be ring-fenced around children's mental health services. So that's basically.
Thank you.
Thank you. Saskia?
So just touching some more on CAMS services, how do you think this, move on to maybe ask this for Joe, if you could answer this one, how do you think access to CAMS services could be improved?
Times Change don't really do anything around services, so I would, if I can politely, offer that to anybody else to answer.
Shall I kick off? I'm sure others will have things to say. Improving access to CAMS, I think what it's about is purely about resources, which is it receives the least funding of any of our health services. And so there has to be a question about that. Commissioners need to think about how they have a joint strategy locally. So it isn't just about mental health services being commissioned on their own, because this impacts education, social care, youth justice as well. So there needs to be a joined up process locally, so we have one strategy for children and young people's mental health that cuts across all of those pots of money. And that's the only way we're going to have any hope of a joined up services, and the only way we're going to make effective use of the limited funds that exist. We're looking at limited funds continuing, really, to be realistic. So how do we push where the money's going at the moment is on long-term care, which is the most expensive, and crisis care. We need to push the money upstream, and that requires some bravery on the part of the commissioners, but also they have to be brave because the providers are also pushing to keep that money up there as well. So but unless that does happen, we are never going to properly improve what the situation is. The other thing about access is that there are things that can be done to get waiting lists down, and that hasn't been the focus. So I think it's really welcome that the access and waiting standards are coming in. I think they could come in probably faster than they are happening. They're being introduced around eating disorders as the first thing. But actually what we need to see is local areas taking a very proactive approach to how they manage access into their services, because what's happening is they're getting clogged up, and they don't know if those are good referrals or not good referrals. If we enable that to get sorted, and some areas really have, Tower Hamlets and Haringey, I'm not sure about Haringey, Tower Hamlets, I have actively worked to reduce it now to 8 weeks, and are now working to reduce it to 5 weeks, which is pretty long already, but much better than the 6 months or 12 months that is happening in some areas. So I think it's both joint commissioning and active spotlight on how they manage their waiting lists.
Thank you. I would just add to that, one way that access to support for and services to young people would be to stop dividing it between mental health and physical health. Like, there's a move towards making every contact count, and there needs to be more training for staff in A&E and paramedics and doctors around mental health, so that when somebody presents with a physical health condition, their mental health is also assessed. We know for a fact that having a long-term health condition, you're more likely to develop a mental health problem, and having a mental health problem, you're more likely to have your physical health neglected. So that's an area, we're all, the buzzword for the election was parity of esteem. We actually need a little bit more than parity of esteem. We don't want them to be equal, they need to be connected to each other, because physical and mental health are very connected. So one way of supporting services would be to integrate them a lot more.
Thank you. The final question we're going to ask you is that if you could see one recommendation in our report, what recommendation would you like to see? We can start with you, Liam.
I would recommend proactive mental health to start at a very early age, and to to not go in with the catchment term of mental health, but actually to look at behaviours and attitudes and emotions, I think would be very important. And I think also just connecting that with what it is like to grow up in the UK and connecting the benefit of things like meditation and mindfulness and things like mediation with conflict resolve and also with exam stress and all those things. I think that would be the number one thing for us.
Thank you.
We know that children coming from socioeconomic disadvantaged areas are 2 to 3 times more likely to develop health problems, and they're also less likely to get access to services. So my recommendation would be that vulnerable children be targeted and supported and prioritised, and that the NHSE works with the local authorities to make sure that happens.
My recommendation would be the importance of education, so having a whole school approach to tackling and supporting the mental health and wellbeing of students. This should start at a primary school age, and it should also focus on holding accountable schools, senior management, head teachers to ensure that they have a programme of activities and support mechanisms that will actually be introduced throughout the school.
And for Time to Change, we know time and time again when we talk to anybody, adults or young people, about mental health, that stigma and discrimination comes up time and time again. So we'd really like to see the continuation of work, anti-stigma programmes for us in England, but certainly Scotland, Wales and Northern Ireland. And that we know that needs to be led by a social movement of people with personal experience, so that good quality, accessible services go hand in hand with anti-stigma programmes, and that schools take a responsibility to be able to talk about the subject and the topic of mental health like it's everyday and ordinary, because we know it is.
It's very hard to have one. I would like Ofsted to have in their framework a much stronger requirement for schools to be supporting the development of emotional resilience. I would like to see mental health champions in every school, as in both from young people and from teachers on the teacher side. And I would like to see, a requirement that every place where a child or parent may be, there is information about mental health. Children's mental health.
That's great. Again, thank you all ever so much for your time. It's been a pleasure having you. And with that, I close the third panel of the day. Thank you.
Thank you very much.